We can come to order as the Water Quality Committee.
Chairman.
Sorry. Good afternoon, everyone. We good?
Good afternoon.
Okay, good afternoon. It's good to see everyone and Happy New Year to everyone. This is our first meeting, as you know, in January, and I'm Steve Keene, the new appointed chair, and I welcome everyone and our new members to the committee and our veteran committees, or members to the committee. And we thank you again for coming. We have one individual who's not here today, Tim Bumgarner, but we do have a quorum. But to start out is the call of order here and the notice that North Carolina General Statute 1388-15 mandates that at the beginning of any meeting of the board, the chair shall remind all members of their duty to avoid conflicts of interest under the subchapter. The chair also shall inquire as to whether there is any known conflict of interest with respect to any matters coming before the board at this time. Seeing that there are none, then we will move to approve the draft of the November 8th, 2023 Water Quality Committee meeting minutes that you have in your packet. You'll look those over and I'll entertain a motion when you're ready to make that.
I'll move that the minutes be approved.
Commissioner Twitty made the motion that the minutes be approved. Is there a second?
Not here, so can't make it.
We can?
You can.
Chairman, I'll make a second on that.
Commissioner Reardon, is second. Any discussion? All those approved then by saying aye.
Aye.
All those opposed? Being that that was approved and looking over those minutes and other materials throughout the year of 23, including those minutes, then the evidence that the trial review is, it is a big deal. And the dedicated staff with these and other attachments today will show us many complicated factors which are under study and help us navigate a course to complete the committee's task in moving forward by statute. I would encourage the committee to glean much from the staff's presentation today and be prepared for much discussion throughout the triennial review process. With that said, it is only fair to those new members on the Water Quality Committee, and as a refresher to those who are not new, I remove this as an action item today, and the item be placed as number 1 for information only. So we will proceed with that to information item, and we will adjust the agenda to that. I just want to make sure that do I need a vote to move forward with an approved agenda? Okay, we're good. Director Richard Roberts is here, sitting to my right at the top of the horseshoe, and we'll turn it over to him to introduce those who will be coming forward to present these information items for today. Director Rogers.
Thank you, Mr. Chair. To give an overview and for the information item related to the triennial review, Chris Ventalora will be doing that presentation.
Good afternoon, everyone. Thank you so much. And good afternoon, commissioners. And I'm just, give me a second to pull up the presentation here. Good. Slideshow. Oh, no worries.
Mr. Chairman,
Commissioner Deerhake.
if I recall correctly, looking at my notes, we heard an agenda item on this topic in November. And
We
the new members were here at that time, correct?
Thanks.
They had been sworn in.
I believe they were here. There's a few attachments that are part of the action item that was put as an information item. There were some attachments where it's felt like by me and by some others on the Environmental Management Commission that these items need to be gone over again, in particular in reference to the first meeting of the year tomorrow, and make sure we're all on the same page moving forward.
Okay. If just as a reminder, at the last meeting, we have talked over the several months, I guess, there were a number of things that were originally included in the triennial review. E. coli, 1,4-dioxane, of course, all the health standards, and looking at the fact that we have to keep the triennial review moving at a good pace to comply with EPA's requirements for delivery of it. There was discussion about, if necessary, putting the 1,4-dioxane on a separate calendar, a separate path. So if that's what the item is that's slowing down hearing it today as an action item, I'll just remind you of that respectfully.
Thank you, Commissioner Deerhake. Thank you for that. Chris?
All right. Well, good afternoon again. I apologize about the brief technical difficulties there, but I think looks like we're up and running. So again, my name is Chris Ventilaro, and I'm a Water Quality Standards Coordinator with the Division of Water Resources in the Classifications and Standards Branch. So I guess today we'll just be talking again about the 2023 through 2025 Surface Water Standards Triennial Review. Some of this information, many of you members, I think, will recognize some of this information, but we will skip this slide then. And just to give a very quick kind of reminder of what this process is, this triennial review thing and these water quality standards processes. This slide kind of shows a brief graphic of the water quality standards process. And it really begins with the commission designating uses to be protected in the state surface waters. Uses are things such as protection of aquatic life, protection of consumption of fish tissue and water supplies, et cetera. And then the development of criteria, numeric or narrative criteria that will protect those uses. And then those designated uses and the criteria make up what's called the water quality standards. And then those standards are implemented through various water quality protection programs. The triennial review is a rulemaking process that's required through the Clean Water Act. States are granted the authority to establish their own water quality standards, but those standards do have to be reviewed and updated as necessary on a 3-year basis. So that triennial review is actually that rulemaking process by which we go through that, satisfy that requirement and go through that stage. This slide, again, provides just a brief graphic that shows a little bit more in depth what the rulemaking process consists of. We have 3 basic stages. There's a development stage where staff review the current standards, review any updates from available EPA guidance and scientific literature, and then go about developing a rulemaking package to then come to the committee and commission to present for approval to proceed to begin the actual state rulemaking process. From there, the full commission weighs in and there's public hearings are had. We go to public notice and we have public hearings to meet the requirements of the North Carolina Administrative Procedures Act, as well as the requirements of the Clean Water Act. Ultimately, these items come back to the EMC for full adoption into state rule, where they then go on to the Rules Review Commission, who also provides approval, has to review them, provide approval to proceed. And then once the RRC approval is taken care of, then we go to the North Carolina Attorney General to sign off on the package, indicating that all of the rulemaking requirements have been satisfied. From there, since again, this is a federal program, this falls under the authority of the Clean Water Act. EPA does have final oversight of states' water quality standards. So any of these amendments to water quality standards then go to EPA for their Clean Water Act review. Part of that review includes consultation with the U.S. Fish and Wildlife and National Marine Fisheries regarding any concerns that they have related to the Endangered Species Act. And then ultimately, after EPA conducts that review, they will notify North Carolina of whether the amendments are approved, disapproved. They could be partially approved, et cetera, fully disapproved. So that brings us to this triennial review. And this slide shows the focus topics that we're looking at for this triennial review. So I'll go through this list very quickly, and then we have the remaining slides will go into more detail for each of the different topics. So we have updating the human health exposure factors that appear in Rule 02B0208, updating human health criteria that appear in the rules, adopting E. coli criteria for Class B or primary recreation waters, updating the language for our variance rule, variance to water quality standards that appears in the 02B0226 rule. We have a number of technical corrections that apply to a few of our rules. And then lastly, we have a proposal to adopt 1,4-dioxane as human health criteria for fish consumption and water supplies. And I'll talk more about that in one of the remaining slides. Okay, starting off with the first topic, we have the updated human health exposure factors. So exposure factors are part of the narrative standards for toxic substances that appears in the 02B0208 rule. And these standards are used to calculate fish consumption and water supply standards for substances that do not have existing 02B numeric standards in rule. I've provided an example calculation from the 02B0208 rule just to kind of highlight what the exposure factors are and how they play into the calculation of the human health criteria or standards. And for the purposes here, what we're looking to update are the body weight, water consumption rate, and fish consumption rate exposure factors. Now, as I mentioned, oh, yes.
Would you rather we interrupt you with questions?
Nope,
or
that's
wait until
fine.
the-
Either way is fine.
Commissioner Ellison.
I'm
Oops.
sorry. Back one,
Which one here? This one?
that.
Yep.
So is that the only equation that you use?
No, so this equation represents, we basically, for the human health criteria, which, and I'll talk a little bit about this more later, but when we're talking about human health for toxics, we're generally talking about protection of fish consumption, human consumption of fish tissue and shellfish, as well as protection of waters classified as water supplies. Those are public water supplies. So we have two different calculations or groups of calculations for non-carcinogens, and also two for carcinogens. So each carcinogen and non-carcinogen has one calculation that's specifically for fish consumption and the other calculation that's specifically for water supplies. And this is an example of the water supply calculation for non-carcinogens. And you can see that basically what's part of this calculation is a toxicity factor, which in this case, because it's a non-carcinogen, it's a reference dose or RFD, a relative source contribution, and then those get modified by the exposure factors, the body weight, the water consumption rate, fish consumption rate, as well as a bioconcentration factor or bioaccumulation factor. So I hope that answers. And you can see, actually, if you look at attachment B, where the rules, where we have the rule amendments, you can see the calculation described in that rule as well.
I didn't know if there were alternate alternate equations for different constituents in different scenarios. I think you got it.
Yeah, it basically comes down to whether or not it's a carcinogen and which designated use you have to calculate the standard for.
Thank you.
So, yep.
Chris,
Yes.
go ahead.
Oh, sorry. Sorry, just a little delay in the slides when I click the button there. So as I was saying, these exposure factors are currently defined in the O2B0208 rule. And they were first established back in 1989. And you can see in that middle column there, that shows what the current values for the exposure factors are in rule. So body weight is currently set to 70 kilograms, drinking water intake rate set to 2 liters per day, and fish consumption rate set to 17.5 grams per day. And these mostly stayed unchanged until 2007, where EPA released some updated information for the fish consumption rate. So that fish consumption rate was modified in 2007 to be brought up to the 17.5. And now we're kind of facing the same situation where in 2015, EPA did a big review of their human health national recommended water quality criteria. And as part of that review, they also reviewed the basis of the exposure factors. So they looked at newer National Health Survey information provided through the Centers for Disease Control and determined that, for the national information, the exposure factors have changed. So people are generally heavier than they were back when these numbers were originally calculated. They're drinking more water and they're generally consuming more fish. So that's why these changes, EPA has provided these changes. And what we're proposing to do is to update the current O2B values that are defined there to these updated EPA values so that we can maintain consistency with the current EPA guidelines and recommendations, as well as be up to date on the current science. So this will just be the proposed amendment when we get to it. And that brings us to the updated human health criteria themselves. So as part of that 2015 review that EPA did, they reviewed 94 chemicals to update the human health criteria that they establish as their national recommended water quality criteria. And again, when we're talking about, for the purposes of these chemicals, when we're talking about human health, we're referring specifically to the consumption of fish and shellfish by people, as well as protections for water supplies. So when EPA looked at the updated information for each of these 94 chemicals, they updated toxicity factors when appropriate, so reference doses and cancer values. They included or updated relative source contributions. And then, of course, as we just talked about, they updated the toxicity exposure factors. And the link here will bring you right to EPA's National Recommended Water Quality Criteria page, so you can look at the individual criteria. And we've also included as a attachment a kind of a list of summary documents for each of the criteria that we're proposing to update. So based on those 94 EPA criteria that they updated, the goal for this triennial review that we're proposing is to focus on the 14 chemicals that correspond to existing water quality standards in the O2B rules. So we're basically breaking up this group of 94 chemicals to focus on the ones that already exist in rule. And then next triennial review, pick up the remaining 80 or so. And that'll give us time to evaluate that larger chunk of values of criteria, and also time to write up the regulatory impact analysis, because that's a large number of chemicals to look at. So of these 14 EPA chemical criteria, they correspond to 26 standards that already exist in the O2B rules. 12 of those are in the fish consumption, protect for fish consumption in the O2B0208 rule, and the remaining 14 protect for water supplies, and those 14 appear in each of the 5 water supply rules. This table lists out the 14 chemicals, and it shows the current fish consumption and current water supply standards that are in rule now. And then the 2 columns after that show the proposed fish consumption and proposed water supply standards. And we've kind of color-coded them to give folks an easy way to get an idea of how these numbers are changing. Some of the updated EPA numbers are going to be higher than the existing standard, and some are going to be lower. So those coded in blue will be lower, and those color-coded in green will end up being higher than the existing standard. And a lot of that has to do with how the information that EPA looked at has changed over time. Some of the criteria have updated toxicity information, which may indicate that the chemical needs to, the ultimate value needs to go higher. So these are the 14 chemicals. And again, you can see we provided some chemical human health criteria summary sheets as an attachment that you can look through to get a little bit better idea of how these were calculated, and a little bit more information on the actual chemicals themselves. And you can also look at EPA's actual national recommended criteria documents that are on their website that I provided the link for earlier to get a lot more information. Okay. So ultimately, we'll be proposing to update all of the existing standards in the O2B rule and to address the remaining EPA criteria in the next triennial, which would be the 2026 to 2028 triennial. Going to shift gears here to E. coli. I don't know if anybody has any more questions about human health criteria. Okay. So the proposal for E. coli is going to be to adopt E. coli criteria for Class B waters. So Class B waters are protect for what's called the primary recreation use. And basically what that means is primary recreation covers waters that are basically frequently used by people engaging in recreation activities that involves full body exposure to the surface water. So you just think, you know, popular areas where people are going swimming and having a good time in the water. And this is significant because with that full body exposure, there's an increased risk of ingesting water, which increases the possibility of ingesting pathogenic organisms, which could lead to gastrointestinal illnesses. So we currently have a standard for Class B waters, which uses the fecal coliform bacterial group as a bacterial indicator. And in 2012, EPA published updated bacterial indicator criteria for these primary recreation waters. And as part of that criteria, they provided states a number of different options to consider. One of those options was the use of different organisms. So the option there is to use either E. coli or another group of bacteria referred to as Enterococcus. And the thing that these bacteria have in common is that they're all bacteria that can be found in the guts of humans and other animals. So they're really used as an indicator of fecal contamination in surface waters. So based on this selection, we're proposing to move forward with adoption of E. coli standards for a few reasons. One is that it's very much a widely used indicator for freshwaters. And again, when we're talking about these Class B primary recreation waters, we're talking about primary recreation in freshwaters. We have separate primary recreation classifications that handle saltwaters. And those are already up to date using the latest recommendations. So here we're focused on freshwater. So the E. coli is widely used across the country as a bacterial pathogen indicator in freshwater. It's also used by all of the other EPA Region 4 states. Part of the, so once we have that selection, we're moving forward with E. coli. The 2012 criteria recommends that to establish the actual criteria or the standard for E. coli, EPA provides an option for using one of two illness rates. And these illness rates basically estimate the rate of illness that will occur per number of recreators in the water body. So you can see in the table, we have option 1 and option 2. Option 1 indicates an illness rate of 36 illnesses per primary contact recreators. Option 2 indicates an illness rate of 32 illnesses per 1,000 primary contact recreators. And each of these illness rates has corresponding geometric means, which provide kind of a central tendency of E. coli concentrations over a 30-day period, and also what's called a statistical threshold value, which is there to kind of protect for high-level exposure events. And it does this by limiting the number, basically limiting the number of times that samples can exceed that value as a percentage of the total number of samples taken. And that'll make more sense, I think, when I show the next slide that has the actual rule language, draft rule language for that. So once we selected which organism to go with, which is E. coli, we then had to determine, which of these illustrates do we use, because EPA considers them both to be equally protective. They both satisfy the requirements of the EPA criteria to protect human health from primary recreation. So to do this, to help answer this question, the department conducted a study of fecal coliform and E. coli bacteria in Class B surface waters throughout the state. And this study is provided as an attachment. And I'm not going to go into the details in the interest of time, but the basic summary of that report is that we didn't really see much of a difference in the results. And all of the results kind of indicated that by using either of these illness rates, you're going to get very similar protective rates. And those protective rates are also very similar as being compared to fecal coliforms.
So which attachment is that?
That should be attachment ABC. I think that's D.
Thank you.
Yes. Yeah, it's attachment D.
Thank you.
So from there, from the result of that study, and also as a result of consulting what other states are doing, most other Region 4 states are using option 1, as well as we also talked to some laboratories, our department laboratories, one of which is already set up to do E. coli testing, and the other of which indicated that of the 2 indicator species that they would prefer to use E. coli, and also commercial labs, and many commercial labs are already set up to do E. coli testing as well. So based on all of that information, we are proposing to go with option 1, which is the 36 illnesses per 1,000 recreators. And I'll ignore the proposed amendment information there for now, but really focus attention on the draft rule language, which I'll read through very quickly. The draft rule language applies to Rule 0219 3B, and basically says that Escherichia coli, which is the long way of saying E. coli, shall not exceed a geometric mean of 126 per 100 milliliters, colony forming units or most probable number, which I'll mention in a second, based on at least 5 samples taken over a 30-day period. Escherichia coli also shall not exceed 274 colony forming units or most probable number in more than 20% of the samples examined during such period. So the 126 and the 274 are highlighted because those are the geomean 126 that was associated with the illness rate option 1, and the 274 was the statistical threshold value associated with option 1 that was associated with a 20%, allowing a 20% exceedance of the samples during that same period. So I hope that makes, seeing in rule language form may make it a little bit more clear. This rule language also mimics very closely what the existing rule language is for fecal coliform bacteria. So it's not very different. It's really just kind of changing the indicator and changing the values associated with that indicator organism. Getting back very quickly to the colony forming units versus most probable number, those are both units of measurement. And they're different based on which analytical method you're using to analyze for E. coli in the surface water. So the traditional analytical method is called a membrane filtration technique, and that reports as E. coli as colony forming units, and really you're filtering water through a disc, putting it on nutrient meter, and you're literally counting the number of colonies that pop up. But however, newer methods, most notably the co-alert methods, which are very, very widely used and very common, report E. coli as a most probable number. So we wanted to make sure that this standard, because E. coli is because those newer methods are more commonly used, we wanted to make sure that the rule reflected that option to use both of those methods. And lastly, I just wanted to give you, I know this had come up in some of the information items that we provided last year. We just want to give a quick visual of where Class B waters are throughout the state. And again, you see a big gap on the coast areas. That's because that coastal area has its own primary recreation classification, which is called Class SB. So it has its own standards, and that's why it doesn't appear on this map. Okay. That brings us to variances. So part of the triennial is going to be proposing updating our language for surface water quality standard variances. Rule 02B 0226, which is called exemptions from surface water quality standards, lists a few different exemptions, including variances, revisions to standards, and site-specific standards, and then references, I think, two North Carolina general statutes as the source of information to go to determine what is required for these exemptions. EPA has been requesting recently that states update their variance language to make it more clear to the public about the actual requirements of water quality standards variances. So they've requested that states either reference Title 40 of the Code of Federal Regulations, Part 131.14, or they specifically list out all of those Title 40 Code of Federal Regulation requirements in the rule. So we're proposing to just reference Title 40 CFR 131.14, and you'll see that in the attachment B, which has the rule amendments in there. You can see the actual language. Now, just to be clear, this doesn't change any requirements. This doesn't change anything for the regulated community. Anyone seeking a variance to water quality standards would have to meet these 40 CFR requirements regardless, because EPA ultimately has a final approval of those. This is just making it clear per EPA's request for the stakeholders so they could actually see, where those requirements are listed out in the federal regs. We do have a couple of technical corrections as well that we're including. And they apply to Rule 02B 0208 and also to two of the water supply rules, 0215 and 0216. The changes being proposed for Rule 0208 are mostly they're really just updating references. A lot of that rule was written in 1989, and a number of references in that rule have become out of date. They don't match the current EPA guidelines. So we're updating that language so it matches the current EPA guidelines so that we remain consistent with the current science and EPA's current view of what is considered scientifically justifiable. From there, on the 02B 0215 and 0216 rules, this is really just an effort to reinstate technical corrections that the EMC approved in 2022. So these technical corrections apply to 0215 2F and 0216 2F. And the EMC approved of these, but these rules were subsequently objected to by the RRC in 2020. That objection, however, was not related to these technical corrections. So we're just putting them back in here to get those kind of back on the books. And again, you can see these technical corrections in attachment B. And then lastly, that brings us to 1,4-dioxane. Now in November, we did come before the committee and indicate that 1,4-dioxane was being considered for either inclusion in the triennial review or to proceed as its own rulemaking path. And just a little bit of, so we're presenting it here for your consideration as part of the triennial review. For a little bit of background, the EMC had adopted fish consumption and water supply standards derived from the 02B 0208 rule on March 10th, 2022. The RRC, after that, objected to those rules on May 19th, 2022. So what's being proposed here is just the same exact thing is being proposed, with the slight difference in that because we're looking to update those human health exposure factors, we would have to recalculate the concentrations based on those updated exposure factors. So that brings us to these new numbers and in that table there, you can see what the current consumption in-stream target values, basically what we call those numbers, the standards that have been derived from the 02B 0208 narrative standard. We refer to them as in-stream target values or derived criteria. So the current ISTV is 80 micrograms per liter, and the current water supply ISTV is 0.35 micrograms per liter. Based on the recalculating them using the updated exposure factors, would bring the proposed fish consumption value down to 73, and the water supply standard would remain fairly unchanged at 0.33 micrograms per liter. A little bit of a lag in the slides. I apologize for that. So the last thing I guess I'll touch on here then is the estimated rulemaking timeline. Well, originally, this may, I suppose this will be a little bit different. So maybe I'll skip this, but I will say, I do want to indicate that per the Clean Water Act, we do have to hold a public hearing within 3 years of our last triennial review public hearing. So our last triennial review public hearing was held in July 20th of 2021, I believe. So that would put us at mid-July for holding our next public hearing. And that's about all I have for today. So
Thank you,
happy
Chris.
to answer any questions.
Yes, and before we go any further, I just want to make it clear that we appreciate as a committee having commissioners that are not on the committee sitting in the horseshoe. Some years ago, when I was appointed back in 08 or 9, I remember where the commissioners were sitting out there and just the committee members were sitting here. So it's refreshing to see all the commissioners that are interested in this moving forward that are here today. But I would like to remind the committee members that we would like discussion and question and answers from the committee. And if the ones that are not on the committee, which would like to speak, know that they are speaking with their concern, but let's keep the topic what it is and keep the committee where it is and welcome the members who are not on the committee. And those that are not on the committee that are here, I'd like to recognize them, starting with Commissioner Solomon, which is ex officio, of course, and of all the committees, and Commissioner Weiss, Jill Weiss, and also sits on our Air Quality Committee, and Commissioner Robin Smith, former chair of the EMC, and she is here today, and we welcome her as well. And Commissioner Charlie Carter, who is chair of Air Quality. Thank you very much for coming. So with that, any committee members have any questions for Chris and moving on this subject? Commissioner Ellison.
Thank you. If you would go a couple slides back to the rule that was objected to by the RRC in 2020, what was the nature of that objection?
So it was objected in May 19th, 2022, and they had objected to the rule related to the inclusion of the 1,4-dioxane.
Oh, I'm sorry. I think it was one slide. It was not the 1,4-dioxane. I think it was.
Okay, this one here, the technical
Yes.
corrections. Yeah, so that was the same rule,
Okay.
the same objection. And that's why I just got caught up in that objection.
Okay, thank you.
Commissioner Twitty.
Right.
You had one slide a few back that said EPA requested that in the variance. Is that a nice way of saying EPA requires that to be done, or is it truly a request? I'm trying to understand how this works. I think your point you made at the end was correct, that I guess it's somewhat moot whether it's written in or not, because there's federal and state requirements, but I'm just curious about that.
Yes, usually EPA, we are frequently in contact with EPA discussing the rules and kind of requirements coming down the pipe, basically. So EPA will often kind of communicate with us in advance to say, hey, these are things that we're looking at in rules and that, we like to see and want to see changed. So it's not, at this point, it's not a formal declaration that you have to do this, but it's kind of the initial stages of saying, this is what we're thinking. So, and this is the direction that we're going in.
So you do receive, and not just you, the departments receive both from EPA, requests and requirements?
They can.
Okay.
Yeah. And a good example of that is a recent promulgation of standards in Florida.
Okay. Chair King, can I ask one more?
Please.
Completely unrelated,
Yeah.
but it's been bothering me. So why, in all the materials, I haven't been able to find out anywhere, why is there the push to change from fecal coliform to E. coli?
Oh, yes. So basically EPA, fecal coliform, the use of fecal coliform as an indicator of pathogenic bacteria goes back decades and decades. It was kind of like the first, pathogen indicator that was used. Over the years, through the research that's been done and the work that EPA has done, they've established that there are clearer relationships between E. coli or Enterococcus concentrations and the occurrence of gastrointestinal illnesses in recreators. So there's epidemiological studies that have been supporting this shift away from fecal coliforms. And the shift, it's been something that's been ongoing for many years. So they've been looking at this for quite some time. In the 90s, I think, may have been the first time they started really looking at switching from the fecal to like E. coli or other indicators of pathogens.
Okay, thank you.
Yeah.
Commissioner Derhack.
Thank you. I would just add that North Carolina is one of the last remaining states to have a fecal standard instead of the E. coli. So my question is about schedule. Could you put up the calendar again, if you don't mind, please? Okay, and what was the remark you made about public hearing, 3-year rule?
Yeah, so I mean, EPA, the Clean Water Act requires that we review and update our water quality standards every 3 years. The way EPA interprets that is basically using the public hearings as the measure of the time mark. So once you hold a public hearing for water quality standards triennial review, 3 years from there, you need to be holding another public hearing.
Okay, and so this is related to my original remark at the beginning of the meeting about we are obligated to stay on schedule with the EPA for these triennial review packages. So if this is an information item today, which it is, that means we have March to hear this at water quality. And if we stick with our 30-day rule, then it will be May full EMC vote. Can the division put together a notice of public hearing and still hold the July public hearing? I just want to make sure that's feasible.
Well,
If we vote in May to take it to public hearing.
yeah, we'll just have to work out the numbers because we have to have, so if we voted in May, if you voted in May, EMC voted in May to approve to go to public notice, we would, depending on when that vote fell in May, we may be able to submit the NC register information in May, in the middle of May, which would get us published in June. And then we have to have a minimum of 45 days from the time that we're published to the time that a public hearing can be held. So yeah, we'd be looking at.
It's close.
It's close. Yeah, we'd be looking at kind of like July. Yeah, and that's if we could indeed make the May submission of the materials in May for the North Carolina Register to get published in June. If we have to wait till the beginning of June, then we would be kind of possibly a month later than that, I think.
And EPA just looks at the month, not the date in the month, right?
Yeah, well, as far as I understand, we haven't really had conversations about this with EPA. At least I haven't heard of conversations. We haven't had to have those conversations, so I'm not sure exactly, what their response will be to that. But yeah, that's something we would have. Well,
so I just want to raise awareness of the time sensitivity. Thank you.
Yep.
Commissioner Ellison.
Thank you. Kind of building on Commissioner Tweedy's question, a lot of the documents referenced in what has been provided to the commission and the committee and some of your slides, the EPA recommends and the EPA suggests again, how strong is that as a recommend? What would DEQ have to do to go against a recommendation? How strong are those words?
Yep. So it really comes down to kind of scientific justification. So in 2015, there was an amendment to the Clean Water Act that basically stated that states have to review these guidance that EPA publishes, and then from there they can choose to adopt the guidance as is, or they could provide alternative information to adopt different standards. But it really comes down to scientific justification. You have to provide information to show why any other number or any other standard or criteria would be protective of the uses.
Does that apply to methods used as well?
Potentially, yeah, it could.
So if North Carolina people were extra fat, we could use a different.
Yeah, we actually could. Yeah, I mean, so that's one thing EPA does recommend that as well. They say, you could use more regional specific public health information. The challenge a lot of times though is kind of finding that information. So if we had data to show that people were heavier, then that could be we could propose a different.
Okay.
Or if they weighed less, it's the same thing either way.
On another,
Well, just a comment on that would be DHHS, and that would come from health assessments from each county. You
Yeah,
could get that
potentially.
information.
Yeah.
Okay, go ahead, please, Mike.
on another note, so you had the map of recreational waters. Do you have a similar map showing what recreational waters would not be in compliance with these new standards?
We do not right now. Generally, we won't know that. Like officially, we wouldn't know that until the standard was adopted and the 303D assessments were able to be conducted. I think with the adoption of a new standard, they would also have to, in order to do the 303D impaired waters list, they would actually have to come to the commission to modify the current 303D methodology to include E. coli. Because right now it's focused on fecal.
Okay,
Yeah.
but for using fecal as a surrogate for E. coli for now,
Mhm.
because you've got the data,
Yeah.
and for some of these other constituents, do you have maps that show which of these recreational waters are not meeting the standards?
Yes, there are maps, and I would definitely defer to our 303D folks just to make sure, but we do have maps of 303D listed waters. I'm hesitant to say without talking to them whether specifically it shows fecal coliform impairments, but that's where that information would
Well,
be.
okay, but that's for under the current standards, not under
That's-
proposed.
Exactly. So it might give an indication of saying, hey, if that information is there on those maps, it would indicate potentially where fecal coliform standards are not being met for Class B waters.
But for fecal and all the other constituents in this proposed rule, you've got the data that shows what the concentrations are and whether or not because and the 303D tables are sufficient because they're pretty specific of where upon a given river an impaired reach may be. But it would be interesting and helpful to see which stream segments would there be non-compliant with the proposed standards.
Yeah, and
Mr.
that would-
Chairman.
Commissioner Deerhake.
Just one clarification. The toxics, the 14, that's not tied to Class B waters, correct?
Those apply to all waters.
All waters, not just Class B. And you were asking about Class B and the larger scope of all of these pollutants, but
Right, but
Okay.
the map would be relatively easy to make in GIS. It's just overlapping the layers. I just wondered if it existed.
Oh, okay.
Yeah, I think it would also depend a bit on the methodology and how those lists are determined. So the methodology has specific requirements for what data is used and how it's used, period of time over which data is looked at. So there would be some variation, and I would definitely, I'd be hesitant to make any definitive statements without someone from the 303D group here
Okay,
to comment more clearly.
thank
So,
you.
Yep.
Commissioner Yarborough.
Yes, I do, Joe Reardon, I want
I'm
to,
sorry, Joe.
that's no problem. I'm
Commissioner Reed.
learning too here.
I'm sorry.
But if I could follow up on the train of thought that Commissioner Edison had, if there are waters that trigger that there would be in violation of these new recreational standards that we would have, does that trigger a forensic evaluation of those waters for probable cause in that, any of that? Does it, from a compliance perspective, does it trigger that?
I'm not entirely sure. I mean, that would fall, usually what happens when we have impaired waters is that if there's a water body impairment, then you end up with a total maximum daily load that applies to those waters. For the bacterial indicator standards, I'm not entirely sure what the process is after that. I think I would have to defer to other department staff.
That's a very much of interest, because if triggering these new standards triggers a forensic evaluation of that water source and probable cause for changing and surpassing these water requirements, that's an interesting thing.
Any other questions for Chris? Any comments before he moves on to the next information item? Thanks, Chris.
All right, thank you so much.
If there are no others, we'll move to the next information item. Director.
So the next information item is an update. We have a semi-annual update on 1,4-dioxane. Jenny Grasnick of our Winston-Salem Regional Office, she's a supervisor out there, will be giving a portion of the update, and Mike Montebello, our NPDES program supervisor, will also be participating in this report.
Hi, can everyone hear me? All right, good afternoon. My name is Jenny Grasnack. I am the Assistant Regional Supervisor in the Winston-Salem Regional Office for the Division of Water Resources. And yes, Michael Montebello, who is out there, is the Chief of the Division's NPDES branch. And he and I will be providing the most recent semi-annual progress report on 1,4-dioxane in the Cape Fear River Basin. If you remember, these semi-annual progress reports are required as part of the Greensboro Special Order by Consent and from 2021. There is a delay. So today I'll update you on the division's ongoing and planned surface water and discharge sampling efforts, including the results of that sampling. Then Mike will provide an update on point source dischargers of 1,4-dioxane in the Cape Fear River Basin upstream of drinking water intakes. He will also provide the most recent update on actions that DEQ is taking to reduce 1,4-dioxane concentrations in the basin, including incorporation of limits into NPDES permits. So let's begin with a discussion of our sampling efforts. The division began screening for 1,4-dioxane in 2014 and 2015. In 2017, an approved analytical method for surface water and wastewater became available, and the division was able to secure funding for lab equipment to analyze 1,4-dioxane on our own without using an outside lab. The division continued to monitor in the Cape Fear River Basin and expanded monitoring into other river basins following that. The percentage and magnitude of 1,4-dioxane detections has decreased over time in the Cape Fear River Basin, except for some spikes, which we've talked about here on occasion, and known discharges. You can see that from this table if you look at the data. In other river basins, 1,4-dioxane was either not detected or was detected rarely or at a much lower concentration than in the Cape Fear River Basin. In 2021, 1,4-dioxane was added to the analyte list for DWR's statewide random ambient monitoring system, which we lovingly call RAMS. In 2024, monthly monitoring will continue in the Cape Fear, the Neuse, and Yadkin River basins, and at 30 of those random sites statewide. Sampling will also be conducted in 13 drinking water reservoirs this year in Cape Fear, Little Tennessee, and Roanoke River basins. And then 2023 data will be added to the online dashboard for the public viewing. So in the Winston-Salem Regional Office began collecting weekly grab and composite effluent samples at these POTWs, or publicly owned treatment works, at various times since 2019. The ones that are highlighted in yellow are currently ongoing sampling efforts being conducted by Winston-Salem Regional Office, and we're going to look at that data. Asheboro. So we started collecting weekly grab and composite samples at Asheboro in July 2021 after high concentrations were seen on their discharge monitoring reports. Asheboro has a significant industrial user named StarPet with an installed treatment system for 1,4-dioxane. It's had a few hiccups from after its startup, but Asheboro is also dealing with their local landfill and dealing with 1,4-dioxane concentrations from that. So sampling at Asheboro is ongoing by our office, and Mike will later discuss the Asheboro NPDES permit. And as you can see by this graph, it shows the final permit limit in their schedule in the permit will be 21.6 micrograms per liter. Winston-Salem Regional Office started sampling at High Point East Side Wastewater Treatment Plant in June 2022 in a very similar circumstance that we noted high concentrations on discharge monitoring reports. High Point has a significant industrial user named Innospec with 1,4-dioxane concentrations that were noted to be higher than normal. The city has worked with them to decrease them over the last 6 months, which you can see here from this graph. Sampling at High Point is ongoing by our office. We began sampling at Reedsville the same time that we started sampling Greensboro. So that was October 2019. Reedsville has a significant industrial user that has greatly reduced or possibly even eliminated their 1,4-dioxane contributions over the last several years. We believe that they have likely ceased manufacturing of the product that was causing the spikes, because it's, for the most part, really static. So you can certainly see how that has impacted their data. Our office has stopped sampling at Reedsville for the time being. We stopped in 2023 because we wanted to pick up sampling in Burlington, which we will discuss next. Oops. Yes, sorry. So we did start sampling in Burlington just last fall after we noted that they had some higher than expected concentrations. In particular, the town of Pittsburgh received the town of Pittsburgh is downstream of Burlington. They received a high result on their finished drinking water, got a result of 11 micrograms per liter on July 19th. Nothing abnormal was discovered in Greensboro or Reedsville sampling data, which are the ones that we typically turn to when there are high numbers. So we reached out to Burlington, who has 2 discharges to the Haw River from south and east wastewater treatment plants. The city of Burlington had, for a short time, sampled South Burlington wastewater treatment plant for 1,4-dioxane in October of 2020 through February of 2021 with minimal concentrations. No reported sampling occurred since. So Burlington was able to, at this time when we found this high result of 11 micrograms per liter, Burlington was able to go back and sample some saved wastewater plant effluent from around that time that Pittsburgh had that sample on July 19th. And you'll see up here the numbers that were determined. They were higher than expected, 160, 86.9, and 57.8, which ended up with Burlington beginning an investigation. So as part of that investigation, City of Burlington has collected weekly composite samples throughout their collection system. They have sampled their significant industrial users, known as SIUs. They sampled their wastewater treatment plant influent and effluent, all with rush analysis so they could get it back quickly from the laboratories. All of that sampling led them to a company named Apollo Chemical, not currently an SIU because their average daily flow is 20,000 gallons per day, 25,000 gallons per day is the cutoff to be an SIU. So Apollo samples showed pretty high concentrations, actually as high as over 8,000 micrograms per liter and more. So the City of Burlington met with Apollo, who was unaware of why their discharge would contain 1,4-dioxane and have begun their own investigation separate from the city. So the city set up a composite sampler at Apollo. They're pulling composite samples daily, Monday through Saturday. And is also going to require them to complete a permit application to become a significant industrial user, simply because of this issue. So for all of those reasons, the Winston-Salem Regional Office decided to add them to our sampling roster, in addition to the others that we're sampling. So that's why Reedsville was removed, since their results have been fairly static for several years. We also, Division of Water Resources also added sampling requirements for 1,4-dioxane for both South Burlington and East Burlington wastewater treatment plants. And at this time, we don't really have, since it just began, we don't have a ton of information or data from all that sampling, but we will be able to provide that to you all with our July 2024 report. So we'll just briefly go over the Greensboro special order by consent for 1,4-dioxane. And I know some of you are new, so we'll just give a brief background on it. The original SOC was approved by the EMC in March 2021 and became effective May 1 of 2021. That original SOC was a 2-year SOC with a year 1 compliance value of 45 micrograms per liter and a year 2 compliance value of 33 micrograms per liter. After that, the Fayetteville Public Works Commission and the Haw River Assembly filed a legal petition against the SOC in April 2021. And so due to those settlement negotiations, an amended SOC was approved by the EMC in November 2021 and was effective December 1 of that year. And that new SOC had a 3-year SOC with lower compliance values than the original one. So 35 in year 1, 31.5 in year 2, and then year 3, 23. And part of that settlement included the requirement for these annual reports to the Water Quality Committee on 1,4-dioxane actions by DEQ and DWR. So the SOC is currently at midpoint of year 3, obviously. Year 3 SOC compliance value is 23 micrograms per liter. The effluent data for the city of Greensboro has been pretty consistent, and I'll show you a graph of that next. The significant industrial user sources have been identified and pretreatment actions have been taken. The city has not actually even exceeded the SOC compliance value since year 1, thankfully. The Greensboro SOC will expire July 15th, 2024. I also wanted to note, you all have a link to this. All of their data, reports, all of the quarterly meeting minutes that they have with us and the NPDS unit are available online if you would like to hit that link. And this is the graph that shows us the discharge data from Greensboro, the effluent concentrations of 1,4-dioxane have really remained consistent over the past 2 years or so. And it shows that the SOC has been effective, and as well as the additional work done by Greensboro has also been effective. So I'm going to turn it over to Mike now.
I have one, I'm sorry, I have one question on one of the slides on Pittsboro. Was that the first one that you showed as far as municipalities under study, or?
Was it a graph?
No, no,
No.
no, it was narrative. Back one more.
This one?
Slide 9.
That's it? Yeah.
Okay,
Pittsburgh received high results. Is that Chatham County?
it is.
Do you have a graph, not a graph, do you have an overlay or a map of where you took these samplings?
Well, I don't here. We have included one in the past, and there might be one in the written report, I think.
And when,
one of the
when
attachments.
was that study or that initiated? On
So-
Pittsburgh, Chatham County?
This particular sample,
Not that particular one, but let's just say that, well, that one too, but when did you first decide to go to Chatham County?
well, they came to us, I guess. I mean, they had noted some higher than, I guess, expected concentrations of 1,4-dioxane in their finished drinking water.
Mhm.
And so for several years, Greensboro has paid for the sampling at Pittsboro. So they pay for their 1,4-dioxane sampling, and they do, I guess, on a weekly basis, they take samples from their raw intake from the Haw River, as well as their finished drinking water. So that's been, I mean, and all of that data also is available on that website link,
Yes.
because Greensboro does collect that data, and so they are publishing it. So for several years, it has been ongoing since Greensboro had some of those incidents.
Just for information though, the Pittsburgh piece, the Chatham County, where the result was high result in the finished drinking water. So I just wondered.
So this
that-
particular incident, so this, they got one of their samples just from, they're taking a weekly sample, and they noted that on July 19th that it was higher than it should be.
Gotcha.
And typically, in the past, it's been because of Greensboro. So they called Greensboro immediately.
Gotcha.
Greensboro said, not us. And so they decided to call Reedsville. Then they contacted us, and we thought, well, on the Haw River, there's only a few dischargers. And so at Burlington was
Right.
our next stop.
Okay, that's perfect.
Is that
Yes.
okay?
Wait a second, we had a question, Commissioner Ellison. Thank you.
You said that Apollo conducted their own investigation.
Right.
What did they find?
Well, it's ongoing. So oftentimes for 1,4-dioxane, I mean, usually these companies have already eliminated a lot of the product. Like if they've gone through all of their product line and noted that they don't have any ingredients for their manufacturing that involve 1,4-dioxane, it's typically being created in the manufacturing process. So it is time consuming because they do have to go back and do some small batch lab projects to determine where it's being created.
Okay. And another question, Ashboro, you said had a limit, I think it was 21?
Yes, 21.6. That will be the final limit after in their schedule for the permit.
And that's in their NPDES permit?
Right.
Are they the only municipality that has something in their NPDES permit?
You want to go, you want to
Well,
switch over? to
yeah,
that?
we can take another question, but he's gonna go all over through that.
Chair Solomon.
This is as a former committee member. Go back to where you were, please.
Oh.
I asked this question last July when I was new to this committee. Go back one more, go back. Just Ashboro, because it bothered me. You remember us talking about this?
Yeah,
Why-
about grab
why-
versus
I never got an
composite.
answer to that. Why are the composite samples above the grab samples? It seems backwards to me. And when you look at the next two slides, that's more from a data standpoint. I would think the composites would be lower than the grab sample. So I guess it feels backwards, that one Ashboro set of data. And I asked you
Right.
about that last time and
Well-
nobody got back with me. So I just got to ask you this time. Nothing hidden here. I haven't forgotten when you show me that graph again.
I mean, this is a little confusing to wrap our heads around, but, so the composite sample does take into account its samples from the entire week. And so there could have been, if you had been grab sampling every day, you might have gotten a lot of hits. You could have, I mean, the grab sample is one moment in time and the composite sample represents the entire week.
Yes.
So when I look at that, what that tells us is that probably what you're looking at right now is one of those high dots.
I'm looking at all the orange dots that are
Yeah.
still hot. And if you go to the next two, just humor me.
Right.
That sampling data looks a lot different than the other two slides, which shows all those composites.
Right. I think with
Other
this,
than the number, it's the Ashboro's the weird one. I'm just asking, why is Ashboro weird?
well, Ashboro is weird because they have a lot more hits than the grab samples are showing us. So it is being, and that is why that we do this composite sampling, because it does show us that Ashboro has a more significant issue than what the grab samples are telling us. If we go out to this facility once a week and collect a grab sample, it doesn't tell us very much. It tells us about that 1 second that we
I
collected that
understand, I
grab.
understand. We just,
But it just means that there's higher concentrations during the week that the composite sample is picking up. Does that make sense?
it could make sense. It's not normally what I would expect. And there's other technical people here, but I wouldn't expect that. But the composites usually level off the grab samples. You just got a lot of high grab samples.
Yeah, it just shows that so maybe the grab sample that we took on Friday, let's say was a 4, but the composite was a 50, meaning that at some point during the week, not on Friday, but at some point
There
during,
were a lot of hits.
Yeah, that
Where
there
the other
was-
one's either high or low. You can do the
Right.
composite to factor out the highs
Right.
and lows of grabs. I
Right.
understand.
okay.
It just behavior I expect would be the other two slides, not this slide. That's the only reason I asked you for
Ashboro
sure.
doesn't follow the same
Okay.
protocol, I guess,
Okay.
but it does kind of fall in line with the issue that Ashboro has.
Okay.
Commissioner Twitty.
Yes, I got a question on slide number 4. The bottom of that table that was presented, it has a footnote that says DWR laboratory practical quantification limit, PQL for dioxane is 1 microgram per liter. That's not the same thing as a detection limit, is it? It is.
It is.
Is that still true today?
Yes, and in fact, so this is the DWR, PQL is one. There are 2 labs out there that do most of the work for all of these facilities. One is a 2 and one is a 1. So a lot of the data that we get is the lowest that they can go is a 2.
But there's a proposed standard of 0.35?
Yes.
Can somebody explain that to me? I'm missing something, I feel like.
That's not really different than a lot of other standards. You would say that if you are below the PQL, then you've complied. That's as low as you can record, so you've complied with the requirement. If it's an EDMR permit.
So that happens in other.
Oh, certainly, other
Okay.
permit conditions, yes. And it would be better if the PQL was lower, but that's where it is currently.
Okay, and I assume it's not unusual over time that PQL comes down with better science.
Yes, sir.
Thank you.
Commissioner Deerake.
Thank you. Can you remind us about the landfill in Ashboro that's sort of different story than the other towns? Is that a municipal landfill or is it the one associated with the Seaboard?
It is, it's owned by Waste Management Incorporated, so it's a private landfill. It is, from what I understand, partially funded by the county. And so it's, City of Ashboro, and then they call it the county landfill, even though it's privately
It's
owned.
not the one in Jamestown. Okay.
Any other questions, comments? Commissioner Twitty. Yes.
Just thinking about application of this, so the current, it looked like the permit conditions that are being written into the ones you showed, like there was one, the Ashboro was 21 micrograms per liter. So that's the effluent that goes into the stream, correct? So if there's a standard set that's around 0.3 or something like that, that effluent will be exceeding it by 100 times. And I assume the logic there is then it gets diluted within the stream. But how an application does that work? So technically, that water, when it's dumping into the river, is way out of compliance with the water quality standard. I'm sure this probably happens all the time too with waste.
So let me try to do Asheboro real quick. I'm Mike Montebello. I'm the NPDS branch chief. So Asheboro is a little interesting because where they discharge, they're discharging into Class C waters. Class C water, the number is different, but they're also discharging above a water supply. The water supply boundary is further down the water body. The requirement for this would be average annual flow, and we're doing this at the water supply boundary. So at the water supply boundary, the 21.6 micrograms per liter, that in-stream concentration, the 0.35, would be met. So it is more flow that's available down at that location. And so this is an example you had asked about permits that we've issued. So this particular, since there's been a fair number, this is a list of the permits, and then the permit number, the facility name, the type of facility it is, what the permit requirement is, which is typically monitoring, and then when the permit was issued by DWR. You note that Asheboro is on here. It's the only one that's a POTW that actually has a limit, and the limit is based on the water supply. The downstream water supply is the critical requirement.
Can I follow up with that?
Yes, please.
So, but there is no, the permit was written before there was a numerical standard, right?
Can I think I need.
I know. That's what I'm just,
I think I can help with this answer. Hi, I'm Julie Grip. I'm a Deputy Director for the Division of Water Resources. So there is no numeric fixed standard for 1,4-dioxane. It's based on our narrative language and 208 of 2B.
okay. Thank you.
And so we're calculating a numeric limit based on the narrative standard. And this list here are the permits that are pending, that are in process. So the only difference here is we're identifying where the status is. So some of these permits are on public notice. Some of them have been drafted and we're working with the permittees. Some of them are in review by staff. And then these are the permits that we would be looking at some sort of conditions associated with 1,4-dioxane. Another facility that's an industrial facility, Alpac Polyester. This is their EDMR effluent data. They're formerly known as DAC. So they have a Cedar Creek site. They're upstream of Fayetteville PWC. There was concerns when we drafted the permit. We looked at the data, and now we're reviewing the permit requirements with the permittee and talking to them about putting a compliance schedule with a limit in their permit. So it's pending. So you asked about the city of Asheboro. So the city of Asheboro's permit was issued in August 2023. The permit was appealed and is currently in litigation. The permit limit had a phased compliance schedule, which went for 5 years. And so we set a 5-year schedule. At the end of the 5 years, the 21.6, there were 2 intermediate interim limits. One was 55.7, the end of the first year, and then 35 at the end of the 3rd year. All of that is pending litigation. So here is the EDMR data for Asheboro with the phased limits, phase 1, phase 2, and then the final limit to show you where their actual data is versus where the final limit may end up being subject to the litigation.
Excuse me, I'm subject to litigation, just to help me understand that. Bring that back to the previous slide with a date. No. Forward, hold. August of 23.
Yes, sir.
And then that's the,
That's the effect, that was the issue date of the permit, and it would have an effective date, but that permit is pending because of the appeal of the permit condition. So it's in litigation presently. So those conditions will be held pending the result of the litigation.
okay, since when that 1.4 doxing then, in November, that was brought up of whether or not, and that was brought up earlier, Commissioner Deerhake, about the scheduling piece in November, the discussion that was had about the staff bringing it either to, as a separate item, or to a group piece that we saw today. So my question is then, going forward, to not hold up the process, of course, but was this a determining factor or a part of the factor in determining whether or not to keep it off in November whenever it came up before this committee in November about whether the state or the staff was going to put it on as part? Does that make sense?
No, sir. I mean, the permit was drafted well before that. I mean, the discussion was with Ashboro. We had draft permits that showed this set of requirements and conditions, and we were negotiating with them on the scheduling, the limits and that. And so it was issued in August, but there really was no coordination between our staff and any of the other things. The intent had always been put, and in fact, I think if you look at my last report, we identified that Ashboro we intended to put an effluent limit for 1,4 dioxane for Ashboro.
Okay. I want to just follow up with that thought, is getting into the determining factor of wanting to put that on, and I'm not trying to put staff or the director on a spot here, but when this litigation is a piece of it, wouldn't it be proper to hold off on what we're doing moving forward with this dioxane until we can get that squared away?
I think it played somewhat into the factor. Obviously, litigation is going on all around these. I think our interest on the triennial review is just to update the criteria. We currently have a rule in place, and we just wanted to update the criteria there. So that's what we were working under as it relates to the triennial review.
Okay. Okay, thank you. Yes, sir. I'm sorry. I'm sorry to break this up. Commissioner Carter, you have a comment?
And I am a visitor, so I'll preface with that, and maybe I've gotten lost in this whole thing. But you were showing the slide a minute ago with the numbers for the Ashboro permit. And I must have been thinking about something else. I thought I heard that there were not numerical standards that have been set yet for 1,4-dioxane. What am I confusing here?
Let me just clarify, there is not a numerical fixed value set. It's a narrative standard. And you saw earlier Chris show you the equation that we use.
Right.
That equation was used to come up with that number that's in the permit.
Well, okay, but you've got a series of numbers there that are declining.
So
based on-
usually in a permit, we put, we can't expect permittees sometimes to meet the standard overnight. So we'll give them a series of numbers to bring it down based on milestones.
So the equation, I assume, that means that the equation produced the lowest value, whatever that was in the third value
That's
up there.
correct, sir.
And it's okay, all right.
And that would be similar if you looked at this Greensville special order of consent. There was phasing over time where the number dropped over time. So that's a typical thing.
Yeah, I remember that in the Greensboro.
Yes.
I didn't know that in the permit,
Commissioner
though.
Ellison has a follow-up real quick. Commissioner Ellison.
Thank you. If the proposed rule were to go into effect, what would Ashboro's number, would it change their permit requirement?
No. Right. A slight adjustment.
Again, Julie Grape with Deputy Director, Division of Water Resources. No, it wouldn't until their permit is up for renewal in 5 years,
And when that happened, would their number change?
just slightly. It wouldn't be there would be no treatment change or anything because it's too insignificant of a difference. But it would slightly lower it. I mean, we've calculated it instead of 21 point whatever, it's 21 point. Yeah.
Okay, thank you.
Okay, you could proceed then. Thank you.
And so, okay, so let's catch up. So permits for the city of Greensboro, High Point, including their proposed expansion, Reedsville and Burlington are all on hold because of the pending litigation. They're parties to the litigation. The updated industrial permit for Alpac polyester to address the 1,4-dioxane limit and a schedule is being worked on by staff. We're moving forward with a permit, a compliance schedule and effluent limits. And then we would give you a summary of discussion of where we are in the next semi-annual report in July of 2024. And hopefully we'll have more. Some of the questions that you brought up today, we might have a better understanding of where we are at that point.
A question on that, please, on timing. If you'll back up one, please. Hold. Semi-annual report in July. Can we get a draft in our March meeting, maybe in our committee meeting in March, of what we're getting close to in July? Or to move the triennial
So
piece,
that report,
if it's going to be a part of it?
the report is just the report of the SOC that we're providing and giving you updates. And then I think the triennial review is a separate process.
This is separate from, this is the permit. This is mostly related to permitting actions associated with 1,4-dioxane, not the triennial itself.
Well, right now, I think anything to do with with the 1.4 dioxane in litigation, you've mentioned a few times, it all mixes. It all comes in. Good Commissioner. I mean, okay. Chair Solomon.
Yeah, just for clarification, I guess I'll ask you, Mike, or whoever. I just want to make sure I've been briefed on this lawsuit. Make sure there's two lawsuits here. There's an RRC lawsuit that we'll talk about tomorrow. There's this lawsuit that is kind of not in our wheelhouse, but is affected by 1,4-dioxane. So my question here is, I know that there's interveners that are tied in, or I understand there are in the Asheville. I've not read that yet. For everybody's thing, I've not read the Asheville lawsuit, so I don't know what's in it. But there are interveners. Can you tell me which of those people on the top line are interveners, or is Alpac an intervener in the Asheboro lawsuit?
Alpac's not, at this point, Alpac is not an intervener. Greensboro, Reedsville, and trying to.
There's three, I believe, that are intervened on one side, right?
Reedsville, right. So Asheboro, Greensboro, and Reedsville are the three.
And then has somebody intervened on the other side?
Yes.
Just for clarity, I just want Commission to know we can have that officially on the, because there's several utilities here involved.
Good afternoon. I'm Sushma Mace-Moore, Assistant Secretary for Environment. On the other side, we have CFPUA, Cape Fear Public Utilities Authority, and Fayetteville Public Works Utility is on the other side. The receiving utilities are disputing on the other side.
Right. And this is a different lawsuit than we'll talk about tomorrow, but it is about 1,4-dioxane. And when we talk about all these things that come together on 1,4-dioxane, I think as Commissioner King, Chair King, you're talking about, they all kind of tangle together in a way. But you need, as commissioners, we all need to know, and we appreciate you giving us this briefing today.
And if I may add one more answer to your question.
Yes, ma'am.
One of the rationale for adding 1,4-dioxane in this triennial package stems from the 3 years ago when we did the last triennial cycle. 1,4-dioxane was the time when the EMC adopted the standard, which RRC objected. In the EPA's comment letter to the division, in response to that proposal, they asked us to update the human health exposure values. And they conditionally okayed our use of those existing values. But they said, come back in the next triennial cycle and update those exposure values, and then update your 1,4-dioxane numeric standard. And that for that reason, we have that obligation under the triennial review in order to meet that EPA 3-year requirement.
Yes.
And that will be a decision we will have to make, the fork in the road, when we look at schedule and future meeting, Mr. Chair.
Yes, thank you. That's good information. Thank you very much. Yes, one more, and then we'll move on with presentations. Two more. No.
I've asked a bunch of questions.
No,
I'll just ask you
Commissioner
later.
Robin-Smith.
So as a visitor, just a clarifying question, based on the charts that you were showing earlier of the exceedances in Greensboro, Reidsville, and High Point, all three of those cities had brought their levels down
Yes.
dramatically.
Yes, ma'am.
And I know Greensboro did that without having to impose any treatment technology at their wastewater treatment plant. Is that correct?
Well, Greensboro first had defined the
Right. They addressed the
and then
significant
address the significant
industrial user.
user. So the significant industrial users, and that, I'll just go to the, I'll just do it. So what are we looking at? We're looking to work with significant industrial users to look at alternatives like product substitution and possibly just relocating that particular manufacturing process. So it has been effective in the other facilities to work with the industrial customers to try to get their concentrations down. It's not necessarily everything, but it's been very successful so far.
And that was my question, because what the charts are showing is dramatic reductions in Greensboro, High Point, and Reidsville with no additional treatment technology at the wastewater treatment plant. Is that correct?
Other than us maintaining review of the data and looking at the data and responding to
Right,
concerns, monitoring.
There's been no installation of new treatment
There's
technology.
been treatment installation of equipment at some of the industrial customers on their own to get the
Right.
1,4-dioxane, but it's been at the industrial users' location.
That was my understanding. Thank you.
And so to go forward, we're looking at prioritizing permits based on the sampling results and where the discharge locations are relative to water supply intakes. We're also trying to address challenges with limits that approach the limits of technology, like in the example of High Point is one that's a concern. And then the primary thing would be to work with the industrial users and to find the industrial users to assess the alternatives like product substitution, relocation, or other things that they can do to reduce the 1,4-dioxane concentration. Some of the industrial users didn't even know that they were producing the material as part of their process. And then, again, we would have a semi-annual report in July, which again would focus primarily on NPDES permit actions that we're taking related to that. And I guess more questions, please, sir. And ma'am.
Commissioner Ellison.
Just that report goes to the legislature?
It comes to the EMC.
Okay, is there any reporting to the legislature on any of this?
There isn't a requirement.
Okay, thank you.
And if you will note, the documents have the previous
Sorry,
reports.
let me correct that.
I'm
Yes,
sorry.
there is a report to the legislature coming up in May under the Reg Reform Act. There are 3 1,4-dioxane related studies that we're required to submit. One is with the EMC that specifically asks for the EMC, and we can provide this next time if needed, specifically asks EMC to evaluate the numeric standard and the narrative standards and comparisons with other states. That is a specific charge of the EMC to prepare that report, and the chair and we have talked about that. The second item in the reg reform is for the department to prepare a report and submit to the legislature related to the human health assessment of 1,4-dioxane in drinking water. And our team is working on that with an academic community and the Science Advisory Board. The third report on 1,4-dioxane deals with the cost analysis for treatment operators as well as industrial dischargers in reducing 1,4-dioxane. So it's a cost analysis based on flow and concentrations. And in that study, the collaboratory is tasked, but the department is asked to report. So we're talking with the collaboratory on how best to move forward. All of these reports are due, I believe, on May 1, plus or minus a few days.
Yeah, I believe, yeah, correct. I think ours is June 1, and then the other was 2 are due on May 1, coming up this summer. So, and we have been talking already about how to attack them. So I should look at you too, Director Rogers, but we want to make sure we're square on those. I do, but to clarify, there is not an SOC reporting requirement.
Right. That was what I was responding
that's
to.
what- there's
I'm
not an
sorry, I
SOC
apologize.
for
There's not an
Greensboro. It goes to
SOC
the
for this
drug.
particular.
Right,
So
right.
obviously, there's these others, but not particularly for this. And then, and as we noted, July 2024, the SOC expires for the Greensboro project.
Any questions, comments for Michael? Great presentation. Thank you, Michael. And Jenny, thank you. Wait a second, before we go, Commissioner Ellison, we'll move to the next information
I'm
item.
sorry, but I'm new to this and I have questions.
That's good. Go ahead.
So in some of the supporting documents that y'all provided, it says that 1,4-dioxane is used as a solvent and in laboratories. And y'all have shown several areas that have lots of industry, and you mentioned the polyester, DAC, whatever they are. What are some of the other sources, types of businesses and industries that would get this in their wastewater?
Organic chemical manufacturers. Excuse me, my voice is going. There are a variety. The problem is some of the issues is that it's formed through the manufacturing process, and you may have multiple chemicals which don't initially indicate that you would get 1,4-dioxane, but after you do your process with heat or treatment or whatever, you form and you produce it. So it's a little difficult to, that's why there's a lot of monitoring. If you see, there's a number of permits that have monitoring requirements where we have a lot of industrial customers and we're trying to find those different things. The Greensboro is probably the best example if you go on their website to look at their different industrial types. They have a lot of industrial customers and they did a variety of sampling. And so you can get some idea based on the type of the industry, what kind of concentrations you might expect as a result of that. So that would be my suggestion is the best example at this point. That was probably the hardest one to find because of the sporadic nature of the Greensboro issues.
And is it common in any household products or consumer products?
That I don't know.
Thank you.
Thank you. Thank you again, Michael. We'll move on now to number 2 or number 3 on information. And if Director Rogers would introduce that person.
Elizabeth's going to come up. Liebig, she's with our planning group, and she is going to come up. This is in response to a presentation from last month or last EMC Water Quality Committee, following up on some questions that were asked of staff, and we've had some responses to present today.
So good afternoon. My name is Elizabeth Liebig, and I'm here to present the information item to the committee regarding a request for surface water reclassifications. During last November's meeting, I introduced you to this reclassification request, and today I'd like to provide additional information as requested by the committee. This request was received from Salisbury Rowan Utilities. Jim Beamer, who represents the utility, is in the audience, as well as his consultants. The received request is for portions of the Yadkin River, South Yadkin River, and associated tributaries to be reclassified to water supply for critical and protected areas, since Salisbury Rowan Utilities intends to relocate its existing pump station and raw water intakes to a new location approximately 2,100 feet downstream. Since there are some new commissioners on the committee, I'd like to provide a brief background on this upcoming water supply reclassification, review the rules that apply to the delineation of critical and protected areas and water supply watersheds, and to review the Salisbury-Rowan Utilities proposal. I will also provide additional information requested by the committee during last November's meeting regarding this reclassification, which is proposed under a rule subsection that EMC has not reviewed previously. This information includes a summary of studies pertaining to the river and reservoir hydrodynamics in this area and maps of the critical and protected areas. We'd also like feedback from the committee on the use of this rule as an approach to the critical and protected area boundaries during the preliminary phases of this work. Salisbury-Rowan Utilities intends to relocate a public water supply intake due to sedimentation issues and flooding of its pump station. This map shows the locations of the existing and proposed intakes, as well as the reservoir boundary for High Rock Lake Reservoir. The existing intake, shown as the green circle, is located in the Yadkin River, High Rock Lake Reservoir, just upstream of the confluence of the Yadkin and South Yadkin Rivers, and is presently within the normal pool elevation of High Rock Lake Reservoir. It was constructed in 1917, which predates the construction of High Rock Lake Dam and the establishment of the reservoir in 1927. The proposed intake, shown as the red circle, is located approximately 2,100 feet downstream in the Yadkin River, High Rock Lake Reservoir, below the confluence of the Yadkin and South Yadkin Rivers, and is also within the normal pool elevation of the High Rock Lake Reservoir. Reservoir boundaries are determined by the FERC license, which uses the normal full pond elevation as the reservoir boundary. For the High Rock Lake Reservoir, the FERC license defines the normal full pond elevation as 623.9 feet. This is shown as the dark blue line on the map. Both the existing and the proposed intakes are currently within this normal pool elevation as defined by the FERC license. In fact, the High Rock Lake Reservoir extends upstream from the proposed intake approximately 1.2 river miles following the Yadkin River and approximately 3.1 river miles following the South Yadkin River. This makes the proposed intake a water supply intake within a reservoir for the purposes of the rule. However, Salisbury-Rowan Utilities is requesting that the EMC use its authority under a different part of the rule to allow delineation of the critical and protected areas as if the intake was within a river. So the critical and protected area boundaries are delineated following the definitions in Rule 02B, 0202, items 20 and 48 respectively. This slide shows the language for Part 48 of the rule, which pertains to protected areas. Keep in mind that this matters because permitting and land use requirements apply to critical and protected areas of water supply watersheds. As you can see in the rule language, the protected area are delineated differently when the intakes are within a reservoir and when they are within a river. There will be a map later in the presentation that will show this difference. The proposed intake is located within the reservoir boundary as shown on the previous slide, and therefore the critical and protected areas would be delineated according to Subpart A of this rule by default. However, Subpart C allows the EMC to approve a different distance for the critical and protected areas. Salisbury-Rowan Utilities is requesting EMC support to use Subpart C for this reclassification. EMC has not reviewed a proposal under Rule Subpart C previously. So following the language of the rule to delineate the critical and protected areas for water supply intake within a reservoir, this map shows approximately what the critical and protected area boundaries would look like. Because the proposed intake is within the reservoir, this would be the default critical and protected areas. The critical area is represented as blue and extends half-mile around High Rock Lake Reservoir, which is shown in purple. The protected area is represented as green and extends 5 miles in an as the river runs manner around High Rock Lake Reservoir or to the ridgeline of the watershed. Again, parts 20A and 48A of the rule apply to a water supply intake within a reservoir. Salisbury Rowan Utilities is requesting that portions of the Yadkin River and South Yadkin River, including portions that are within the High Rock Lake Reservoir boundary and their associated tributaries, be reclassified to Water Supply 4 with the critical and protected areas extending a different distance from the reservoir or intake as adopted by the Commission. They are requesting this because the current intake, which predates the construction of the dam, was treated as riverine. Salisbury Rowan Utilities will request that the EMC support the same approach for this relocated intake. Furthermore, they're requesting the critical and protected area boundaries to be delineated following subparts 20B and 48B of this rule, which pertain to water supply intakes within a stream or river. This map shows Salisbury Rowan Utilities' proposed critical and protected area boundaries. Their approach is to apply subparts 20B and 48B of the rule, which pertain to water supply intakes within a stream or river. The critical area, which is represented as brown, extends half-mile in a straight line fashion upstream from the proposed intake, and the protected area is represented as yellow and extends 10 miles in an as the river runs manner upstream from the proposed intake. During last November's meeting, the committee has asked for a summary of the reports that Salisbury Rowan Utilities supplied to support their position that the critical and protected area boundaries should be drawn as if it's riverine. These studies include the Rudd report, the Doyle report, and the Cormix analysis. Key findings from these reports will be covered in this and the next two slides. The Rudd report discussed 3 zones of water flow within the reservoir basin. These can be seen in the figure on the left of the slide as outlined in the Restoration and Management of Lakes and Reservoirs book. These zones are called riverine at the uppermost region of the reservoir, transitional in the middle of the reservoir, and lacustrine near the dam side of the reservoir. In Rudd's 2018 paper, he evaluated water quality parameters and flow dynamics in High Rock Lake to assist in the development of nutrient criteria, in which he concluded that the upper portions of High Rock Lake are also explained by Cook in his book as riverine. According to the Cook et al. Book, the riverine zone of the reservoir basin is characterized by a narrow basin, high flow, and high suspended solids. Salisbury Rowan Utilities also supplied the Doyle report. Those key findings are summarized here. Increased bed elevations at the existing intake is a concern for the operation of the existing pump station during flood events. This increase in bed elevations is due to sedimentation, which is a natural process following dam construction and establishment of a reservoir. Doyle points out in his report that when a river enters a reservoir in a unidirectional flow, the velocity decreases and a sediment load begins to deposit. The coarsest fraction of the transported sediment in a river will be deposited at the most upstream extent of the reservoir, often in the channel upstream of the main pool of the impoundment. Reservoir deltas always grow in the downstream direction. In the Yadkin River High Rock Lake Reservoir, the delta is present at the existing intake location and extends downstream approximately 4 river miles of the proposed raw water intake. The Doyle report concludes that the bed elevation at the existing intake has increased more than 10 feet since the original intake was constructed in 1917, which was prior to the construction of the dam and establishment of the reservoir in 1927. It was further concluded that the sediment delta is caused by High Rock Dam. The dam and its sediment delta are the primary causes of increased water surface elevations at the current intake. The observed sediment delta and increased bed elevations at the existing intake are consistent with the hydrodynamics expected in the riverine zone or the upper regions of reservoirs like High Rock. The last piece of information supplied by Salisbury Rowan Utilities was the Cormix analysis. Water flow was analyzed at the Salisbury Rowan wastewater treatment plant in 2006 as having a uniform bounded cross-section with steady unidirectional flow of 735 cubic feet per second. The NPDES discharge is located 2 miles downstream of the proposed relocated raw water intake. Flow hydrodynamics were evaluated in scenarios where High Rock Lake was at or around Fool Pond elevation. A characteristic of reservoirs is that the water that enters the reservoir basin begins to slow and sediment is deposited. In the upper regions of reservoir basins, the water flows unidirectionally over the sediment deposit as it approaches the main impoundment of the reservoir. Greater unidirectional velocities occur farther upstream in the sediment delta. Continued distance downstream in the delta results in slower unidirectional velocities. Therefore, unidirectional flow is expected in the upper regions of the reservoir basin where sedimentation is occurring. This map summarizes the information that was requested during the November Water Quality Committee meeting. This map overlays the two maps shown previously and displays the critical and protected area boundaries using the rule language for an intake within a reservoir and for an intake within a river. To provide enough detail for the committee to move forward, also included are the critical and protected areas of other water supply watersheds in the area. The High Rock Reservoir boundary is shown by the black line running along the outside of the reservoir, which is shown in purple. Since the proposed intake is within the reservoir boundary, the rule defaults to the critical and protected areas as shown on the map in the blue and green areas, respectively. Salisbury Rowan Utilities is requesting the proposed critical and protected areas be delineated a different distance and follow the rule language for an intake within a river. The proposed critical and protected areas are shown in brown and orange, respectively. Note that the proposed protected area includes both the existing protected area in light orange and the new protected area in dark orange. Also in November, we received questions on distances from High Rock Lake Dam. The proposed intake is approximately 19 river miles upstream from the dam. The High Rock Lake Reservoir boundary is approximately 20.2 river miles up the Yadkin River from the dam and approximately 22.1 river miles up the South Yadkin River from the dam.
I have a question.
Yes.
I'm sorry. Explain to me what a river mile is and how it's computed.
Right, so since rivers bend, and you would be following the direction of the river. So as the river curved, the mileage would continue along the curve. It wouldn't be a straight line from A to B.
So as a crow flies, I guess like my granddaddy said. So
Yes.
how far is that straight?
So from straight, I would have to look back on the map and calculate the straight distance A to B. But if you were to follow the water direction,
Oh, yeah.
yeah, this is what those measurements are.
Okay. Gotcha.
Also in November, we were asked about comparable scenarios. We researched this, and one instance near the town of Ramsar was identified. A water supply intake was located within Sandy Creek, and the critical and protected areas were developed based on the riverine intake. After dam construction and establishment of the Ramsar Lake Reservoir, the intake was then moved into the reservoir. The critical and protected area boundaries were then revised to reflect the conditions of an intake within the reservoir. So this table conveys the land area that is protected as a result of the delineations of the critical and protected area boundaries shown on the last slide. The first column shows the area if the boundaries were delineated for an intake within a river, as proposed by Salisbury Rowan Utilities. In this scenario, the critical area encompasses 4/10 of a square mile, while the protected area encompasses 66 square miles. The second column shows the area if the boundaries were delineated for an intake within a reservoir. In this scenario, the critical area encompasses 86 square miles, while the protected area encompasses 309 square miles. The last column shows the difference in area between these two scenarios. The next steps for rulemaking can be seen on this slide. For rulemaking, the next steps include conducting a study of the waters to be reclassified, obtaining local government resolutions, which must be obtained in all locales of the protected area, preparing a rulemaking package with a fiscal analysis, and returning to the committee later this year with an action item requesting approval to go to the EMC, and then out to public notice with the reclassification. Salisbury Rowan Utilities has also provided a project and funding timeline where they anticipate BRIC FEMA grant award being awarded in the spring of 2024, with a project completion to be expended and completed within 3 years of that award. So are there any questions or concerns with Salisbury Rowan Utilities pursuing this approach?
One of those maps,
Commissioner Yarborough.
yes, Bill Yarborough. If you could go back,
To the map?
yes. Well, that's correct. That's okay right there too.
Oh, okay.
It's obvious there's not a lot of difference in the protected and critical area, but there is some. Then when you go to the chart that talks about the differences, there's not a lot showing on that. But on the impact of where it's located, been any comment period from landowners that may be subjected to that change? Or will there be when you get this report in?
I believe that would be an opportunity for during the public hearing comment, out to public notice.
Thank you.
Commissioner Twitty.
So question on that map, I might be interpreting it wrong, but I'm trying to understand the colors. At the very, very top of what's being proposed, I think we're seeing the overlap of the existing protected area and the proposed.
Correct.
But there's a difference at the top in 2 locations. Am I seeing that right?
You are saying that correct. So the light yellow at the top where you don't see would be eliminated because they are moving the intake 2,100 feet down the river. And so from the top, it would also be coming down approximately 2,100 feet.
Okay, and that goes back to the riverine.
The riverine scenario
2,100.
would be 10 miles
10
run of the river.
miles.
And so if you went 10 miles up the no proposed location,
But it's not a clean line, so they're doing some interpretation there of following a road or a ridge or something like that.
right, correct.
Okay.
So
Okay, thank you.
River Mile.
river mile.
Commissioner Carter.
Yeah, well, and let me follow up on Commissioner Tweedy. So you'd be coming in at the top of that protected area and you'd be pushing it out over on the left side, correct?
Correct, because the new location also includes the South Yadkin River, where the existing intake does not
Where's the South
include the
Yadkin?
South Yadkin
Oh,
River.
okay.
So you would need to account for the South Yadkin and its tributaries.
So presumably then the folks who are most affected by this are the folks in that area, that extension that we go out off the South Yadkin, correct?
That would be a new area, yes.
Well, the one, I'm looking at your map here and I'm scratching my head over this. What is the big sort of, whatever you call that color, aquamarine or so on the area? It says on your map, it says approximate protected area following reservoir rule. Now, is that currently the case or not? I don't understand how that relates to the Salisbury Rowan area. They want protected up here in the upper left.
Right, so an intake located within a reservoir would be delineated following those 0202 rules, sections A. And that rule reads that it extends 5 miles in an as the river run manners upstream from and draining to the normal pool elevation of the reservoir. So that is where the protected area, if you have an intake within a reservoir, would be delineated.
So you're coming 5 river miles downstream then and then?
Draining to the reservoir.
So would that then disappear if we go to a riverine?
Yes, if it is selected as riverine, then it would be the orange
Just those
and the
bits up there,
brown.
and the rest of this collapse it. Well, okay, all right, because I was, wondering if that meant that there was other intakes that were otherwise being protected or involved with that larger area. Okay. I think I got it now.
Commissioner Weiss, and then Commissioner Durham.
That chart down that next slide. Looks like
Mike, please. The mic.
Yes.
Yeah, thank you.
Could you go to the slide, your last slide where you showed the differences?
And the areas?
Yes. Okay, so, as it is now, there would be 395 square miles of total critical and protected areas. If the EMC, goes with the idea of a riverine intake, as apparently we have the authority to do, it reduces that to 66.4 square miles.
Correct.
So I have a couple of questions really about the timeline. Number one, it looks like DWR is willing to undertake steps to make this happen before you know if the EMC is going to approve this. You're also, looks to me like in your next steps, going to start before Salisbury Rowan has talked to other stakeholders and gotten approvals. Plus, if you're working on the assumption that EMC is going to approve this, a lot of stakeholders aren't going to be contacted because, as Commissioner Carter just pointed out, it's a much bigger area if you go with the reservoir intake. So I'm just, it feels like you're, in a way, it's great that you're here so far in front of the process, but
we're still in the preliminary work, so there would be modifications made to pursue the reservoir scenario. However, at the request of Salisbury Rowan Utilities, who wanted to get the process started, we have started the preliminary work. So modifications can definitely be made, and timelines would not be changed very much. It would just be, the main focus at this point would be the local government resolutions that are covered in the protected areas.
of course, if worst case scenario for Salisbury Rowan, if the EMC eventually does not vote to allow them to do a riverine intake, then they are kind of back to square one with having to do the outreach to the wider community. And
correct. We could keep the existing outreach and then just modify to include the other regions. Yes, that is correct.
Well, thank you. Thank you. I wondered if I was understanding that correct.
Thank you for the question.
Commissioner Durham.
Thanks. This is confusing to me. I want to make sure I understand what's current and what's proposed. So you're looking at two scenarios, but the fact remains that the intake is currently in the lake.
The current intake is within the reservoir, yes.
So by changing it to a riverine designation and moving it somewhat, not much, but just enough to get it out of the sediment, completely changing the approach to protecting the quality of the water for the intake for the Salisbury by reducing the amount of acreage that is considered critical and has limited development conditions on it, correct?
Yes, the current intake was developed in 1917. So it was a river conditions at the time that it was used. The dam and the establishment of the reservoir came 10 years later in 1927, and that's when the sedimentation and the reservoir boundary. So that's why that reclassification hasn't been changed, but.
Well, I'm trying to look at this not only from a point of view of the quality of water that's going into the intake to Salisbury, that people of Salisbury will drink, but I'm also wanting to look at it from the coverage of protection for water quality in the lake itself and for intakes downstream. So with the lacustrine approach, you're protecting water quality and potentially, I think, am I wrong, improving the potential for water quality for the intake for Salisbury because you're protecting more area, but you're also protecting the water quality of the lake and future or downstream intakes such as the town of Denton, which is where I was born and raised.
Correct. And if you see the yellow, the light yellow at the bottom of the high rock, that is another example of a reservoir protected area, that there is a water supply intake within the reservoir.
No, I'm just trying to look at the trade-offs between this and understand, is there a substantial difference in the protection of not only water quality in the lake, but also because it would change the amount of acreage that's open for different types of development around it without the critical designation versus just the water quality change, the difference in water quality change and protection versus also the difference in intake quality for drinking water purposes. Can you help us out with that? I'm just not quite grasping it.
I think what we could do here with that question then to help out is we've got the next meeting, and I believe the Salisbury. So if you'll follow up.
Yeah, I mean, I think all these are good questions. And staff has been put in a different situation here. We're trying to communicate the desire of Salisbury, which makes it a bit challenging. And I would suggest that we, I think Chair Keene wants to move on. We could move on. Obviously, we're going to be bringing this back to the committee at the next meeting for consideration. And we can actually take questions and try to respond to those in the interim.
Yeah, yes, I got the comment from Commissioner Ellison, and then Commissioner Smith, Commissioner Carter.
Could you just real quick, top 3 bullet points, explain the difference of land use restrictions for critical area versus protected area? And don't go through them all, just kind of give us an idea, because I think that will go to Commissioner Deerhake's question a little bit. A lot more land would need to be acquired.
Yeah, but in some cases, there is no protected or critical area with this change to riverine designation, so.
Right. In summary, some of the impacts for a critical area involve that new industrial dischargers must meet high-quality water standard criteria. No new landfills, land application of residuals or petroleum-contaminated soils, and agricultural activities would be subject to a vegetative setback. So that would be in the critical area. Examples of protected area requirements for these water supply would be that non-point source pollution shall not have an adverse impact on waters for use as a water supply. And then the average watershed development density levels are established per Rule 02B 0624. And that does restrict some of the densities, whether in the critical area or the protected area.
Commissioner Smith.
So in terms of how we move forward, I guess I'm really troubled by the process and how we got to this question, because it looks to me like the essential question is, if you look at that map, based on where the proposed intake is going to be, it will be in the reservoir, and under our rules, the protected areas and the critical areas are those that are in the green and the blue. So it's the larger critical area and protected area. And it sounds like what is being requested is something that really should be in the form, if anyone wants to rely on it going forward, ought to be in the form of some more formal decision, either interpreting that section of the rule that provides some flexibility. So that would be a rule interpretation. I personally think this may go well beyond just interpreting that language in the rule. I doubt that flexibility language was probably intended to allow some adjustment, but within the general set of requirements for protective and critical areas for reservoirs versus run-of-river intake. So allowing for some flexibility within that, but not the kind of fairly extreme flexibility of calling a reservoir intake a riverine intake and regulating as if it were run-of-river. So maybe we're looking at a rule interpretation question. Maybe we're looking at something like the need for a variance. I'm not sure. But it looks like there needs to be a way to formalize this question and decide that if they want to be able to rely on it going forward with this process. It's a little strange to be trying to figure this out on the fly and give some sort of informal, yes, we think you can go ahead and plan on something much smaller with less, that will include less area, less public outreach, less impact, without having addressed the fundamental question, which is what does this rule mean? And is there a basis for regulating this proposed intake differently than the rule on its face requires? And if there is a reason to do that, how do we get there? What's the appropriate way to get there? Is it through interpreting the rule formally? Is it through a variance process? I don't know. But I don't think this is it.
Thank you for your input, Commissioner Smith. Any other committees, members? One second. Any other committee members? Okay, we'll finish this up, and then I'm going to recognize Commissioner Carter and then Commissioner Solomon to wrap this up. Because he raised his hand earlier, and Commissioner Carter, if you would.
Something that finally dawned on me, and you helped it along. The green area is not currently established, right?
Correct.
Okay, that was my mistake, because I thought we were talking about shrinking something. We're not. It's an either-or proposition.
Correct.
Okay, fine. That's what I wanted to get clarified. Okay.
Commissioner Solomon.
Okay, I chaired the last Water Quality Committee meeting when we heard this, and we went back for more information. So let me go back to what I heard and where I think we are. Salisbury Rowan is moving their intake 1,500 feet downriver because they're getting flooding. They're being resilient. They serve a large portion of this area to people's safe drinking water. They've determined they need to move their intake. They have found a grant. I don't remember if Mr. Beamer's here, but $20 or $30 million, which represents half of their yearly operating budget, as I remember it. So these are big numbers for Salisbury Rowan. That green area is not protected right now. Okay, if Salisbury Rowan loses their grant and has to rebuild their existing intake or go through that problem, none of this gets protected. What we're asking, and I appreciate Commissioner Deerhake, is that if we interpret this as a reservoir option, we're going to put it on the backs of Salisbury Rowan to go down and enforce and to create all that big green area, which does not exist if they lose their funding, or they're not a resilient utility, or they just decide to tell us to go fly a kite. Okay? Not wrong or right, just saying that's where they're at. That's where they'll be at. That's their business decision. For us, we have a rule that says we need to protect the intake. What they have proposed is an option that protects their intake. Protecting the dam 26 miles down the river, or 19, doesn't do anything for their intake up in the yellow area. Protecting that whole lake doesn't do anything for Salisbury Rowan's water intake, guys. It doesn't. So what they've asked us to do is the top part. The last time we were here at this meeting, there was a lot of discussion about the area. Ms. Deerhake wants to do more area, not less. I understand that.
No, I'm just trying.
There was interesting about the determination about the riverine. And what I had asked to happen is there's these studies being made. Where does the staff feel about it? Because if the staff believe it's a reservoir, then EMC can stand in and we can take a vote and interpret it rule because we have the flexibility. We'll put that on the ballot next time and we'll vote it up or down. Because the rule lets us do that. Lets us make that interpretation. We make that on a majority vote. That could be appealed, but I remind everybody here, this goes, and again, the larger area thing, but this still has to go to public comment. We are trying to get something out to go to public comment, not sit around here for 2 years trying to figure out if that's a riverine or a reservoir intake. So I think we have the flexibility. I don't know how this rule was created, Commissioner Smith's thing, but certainly this rule must have anticipated this decision about a reservoir or riverine intake. I don't care, but we've got studies that say it's a river intake. We haven't really heard from staff yet whether they think it's a river intake or not. I'd like to hear that. And if they don't think, and that's what we talked about at the last meeting, Director Rogers, is if staff needs the EMC to help them make this decision, we'll help them make it one way or the other. But if y'all are good with making the decision to support Salisbury Rowan or not, then we won't. So y'all tell us what you want us to do. I mean, that's how I remember it being left last time. So I'm ready to go in March if you guys are ready to go.
Can I ask a question about what we would be
Commissioner
going
Smith.
on, though? I think that's the question. What is it we would be doing in March that would give them the answer to their question?
We would be going to we're preparing the documents to go to reclassification. I don't know how many reclassifications you guys got in-house right now?
I
Is
don't
this
know.
it?
No, there's a handful.
Okay, there's ample. So we would be asking them to bring us the package to go to public comment in March. To public comment on reclassification. That's what we're asking them to bring us. Yep.
Approving anything now.
We'll approve it and we'll get the public comment in March or May. Or we can debate this for a long time, guys. I don't care.
Any other questions or comments? Any committee members in response to that? Commissioner Allison?
No.
Did you want?
I'm sorry, no, just, they cleared it up. Sorry.
Okay.
So let just clarify this. Existing intake, what is the classification now?
It is classified as riverine and from 1917 prior to the dam construction and the reservoir.
Prior to the dam construction,
Right, so it's
correct?
a unique situation.
Commissioner
So I
King,
think
you've got committee members over here.
Commissioner Yarborough would like to.
Originally, I asked a question about how much additional protected areas and critical areas, and that was the very reason for the question is this. There is a lot of agricultural land with what you're talking about in that green. If you were to do that, then somebody's gonna have to explain to the landowners what the impact's gonna be, and it's gonna have to be very quick. So I agree with the idea, we need to make a decision one way or the other, but you're gonna have a hard time convincing me to change that to the green.
Can I just
Commissioner
clarify one thing?
Commissioner Ellison.
I'm sorry.
If you look at where the proposed intake would be, there is no water quality benefit to regulating private land use in the vast majority of that aqua kind of greeny shaded area. To Commissioner Yarborough's point, you're going to upset a lot of folks with no water quality benefit. I would also suggest that the utility has probably made the calculus that it's a lot cheaper to move the intake and get away from the sediment that shreds their pumps and equipment, just beats it up like I can't describe, and not have to, and pay extra for treatment at their water treatment plant, with the movement of the intake, and not have to secure or somehow compensate landowners for changing their land use all around. And if I were a water utility, that's what I would do. I would just move it. And that's not uncommon at all. To move to a deeper part of the river or move to a different part of the river to run away from the sediment. That's a big issue for them.
Commissioner Smith?
So again, I'm not arguing for or against their proposal. I think the problem is how we answer their question and give it to them in a form that is actually useful to them. Because if they just come back with the proposed reclassification on a wish and a prayer that down the road, the commission will be willing to treat that as a riverine impact, I wouldn't feel terribly comfortable with that. So my question is, if it's being put to us as a specific rule interpretation, that we would be better served, and I think they would be better served, to have that specifically addressed, whether it's an interpretive ruling or I don't know if a variance is appropriate. But what I'm hearing everybody say today is the existing intake, if it were installed today where it is, would be considered a reservoir intake. And the proposed intake, where they would put it, is definitely a reservoir intake. And under this commission's rules, the critical and protected areas around a reservoir intake look like the green and the purple. And that may not make any sense in this situation, but that's what the rules say if it's a reservoir intake. And so the question is, I think there are two questions. One is, they may be proposing something that makes perfect sense. I still probably haven't heard as much as I would have liked to about what the actual water quality impacts are on that proposed intake, because there's a reason we have different rules for intakes in reservoirs than we do run of river. That's a technical water quality question. But my immediate question is, I'm willing to entertain their request. I want to be sure we're entertaining it in a way that results in an answer that's meaningful and that they can rely on.
Commissioner, if I may, Commissioner Rogers, because we're not on this committee officially, but
Correct.
Commissioner Rogers, can you pull up, have them pull up the rule, that the three options we have?
I thought you said it was classified.
Okay, I want to remind everyone here, and there's a gallery full, and we thank you for coming, but we do have, trying to get a schedule of items here that staff has brought to the committee. And I apologize for going quite so long, and we have two more items, but we're going to do that if the director has that. But, and answer your question, but I would like to really get this moved on to the next information item. And then we can discuss this as we go forward, but maybe another 5 or 10 minutes and let's try to wrap it up. Request is from Chair Solomon that.
Commissioner Keen, I just asked you a question as the chair. Do you want this to be heard as something that moves forward at the next meeting in March, or do you want us to have a third meeting about this topic? I ask you that as the chairman of this committee. You tell me as the chairman of the EMC what you want.
I would like to move over into the staff and have them to draw up a recommendation. I think that was clear from former Chair Smith that that's something that we need to study. But if staff would bring us something, if we want to make it an information item or an action item, we can determine that as we move forward through the next 6 to 8 weeks, so we can have something in March.
This is a new committee, but that's what I asked for last time as the committee chair.
I got you.
I asked him to bring those 3 studies that she showed you.
Yes.
To get a feel for whether they believe this was truly a riverine or whether it was a reservoir. So that's why she showed you those 3, because we asked for that last time.
Are you ready, staff, to make that determination?
Can we, so I suggest that we move on with the agenda, but after this meeting, we can get our heads together, and by tomorrow's meeting, in your report out to the commission, provide a path forward on this, or next steps.
That will work. That will work. We'll get that before the full commission tomorrow, where we are today, and that will be drawn up by the director, and that initiative will be put forth before the committee, before the full commission tomorrow. Any other questions, comments? Elizabeth, thank you.
Thank you very much.
Director Roberts, next item.
Moving right along. The next item, we'll be doing a presentation on our PFAS surface water quality standard rulemaking. Assistant Secretary Shushma Mazemore is going to be leading off with a little overview of our efforts and what we'll be presenting.
Good afternoon. You guys probably need a break, right?
Yes, ma'am.
All right, I'll be quick, and our team will each present for less than 15 minutes to allow enough time for questions. Throughout 2023, we brought forward a series of educational material and background presentations related to PFAS, as you know. Today, we are returning again with another informational item on PFAS rulemaking. The purpose for these presentations are related to building knowledge base, but also expanding your understanding of what we know regarding this subject, and ultimately to help you review the PFAS rulemaking package that will be brought to you in the coming months. So before we begin with the formal presentations, I wanted to take a moment and provide a few key updates that affects our process in North Carolina and the rulemaking timeline that was presented at the November EMC meeting. So first item that I wanted to update you on is that we had anticipated that EPA would finalize the national primary drinking water standards by the end of 2023. This was for the 6 of the 8 PFAS chemicals that we had mentioned in the last meeting that we would be bringing forward. EPA's final regulation on these drinking water standards is still undergoing review by the Office of Budget and Management. And their website indicates that this should be released early this year. We're anticipating first quarter of this year. Why does this matter? We are using, for the 6 of the 8 PFAS chemicals, the underlying scientific studies and supporting documents for these chemicals are part of the work that we'll be bringing to you all. And so we believe that it is important to base our water quality standards on the foundational information on the final rule that EPA promulgates related to drinking water. So for that reason, we shifted our timeline to bring a certified fiscal note at the March committee meeting with the intent to request a full commission to consider going to public notice in May. So we shifted our timeline by 2 months to accommodate for that promulgation action at the national level. Second, EPA is expected to soon release the final version of a test method. It's called Test Method 1633. You may have already heard of it or may have at least heard of others that may have mentioned it. This is a comprehensive test method that EPA has been involved in for several years. It will allow measurement of PFAS chemicals for 8 different environmental matrices. This is an important aspect of measuring PFAS, particularly in wastewater and surface water, non-drinking water methods. EPA plans to finalize this method for use by states and others by the end of, we believe this month or next month by the latest. Well, how does this help us? We believe that this allows states to allow PFAS monitoring for screening purposes until EPA formally promulgates this method through rulemaking as required under the Clean Water Act. And after that, it can be used as compliance monitoring method. So as you'll hear in a few minutes from Julie, our implementation strategy takes into account this rollout at the federal level, and it's intended to provide some assurance and certainty to the regulated community on the timing and how monitoring will be conducted. Thirdly, in March, EPA plans to issue a final reporting rule that will designate PFOA and PFOS as hazardous substances under the CERCLA regulation. This action is important at various fronts, but primarily it will require affected facilities to report releases of PFOA and PFOS that meet or exceed reportable quantity. The data collected under the CERCLA program will further support the implementation of our own state PFAS surface water rules. It will complement the monitoring strategy that Julie will cover, and it will also provide a better understanding of where the reductions and ultimate potentially treatment is needed. And meanwhile, in December 2023, One other action at the international level was associated with at least those two chemicals. The International Agency for Research on Cancer, this is part of the World Health Organization, designated PFOA as carcinogen and PFOS as possibly carcinogenic to humans. A summary of this evaluation is published and is available, and we will be using that as part of our work too. All of these national and international activities related to PFAS are further supporting the need for state-level attention and potential action to protect our drinking water sources. So next, Julie Gribbs will cover what the proposed rule implementation strategy would look like, including the type of sources affected and a schedule for when they would be required to take different types of actions. And then following Julie, Stephanie Boyard will provide a high-level overview of the fiscal analysis process. This is in anticipation of our fiscal note development. Stephanie will cover the proposed standards and the implementation strategy itself, how those costs and benefits will be quantified. Both approaches will be discussed with stakeholders as our teams begin to discuss these preliminary thoughts in the coming weeks. We hope to integrate these input into the fiscal note development process so that by the time we come back in March, the OSBM has reviewed and hopefully certified a fiscal note. And so I wanted to, introduce some of these things that are happening at the national level that affects what we do at the state. And so with that, I'll pass it on to Julie for her presentation.
Thank you, Assistant Secretary Shaw. Thank you.
Is that it?
That's it.
Okay.
Great, thank you. Hi, I'm Julie Gribb, Deputy Director for the Division of Water Resources. As Sushma was pointing out, along with adopting the PFAS standards, looking at that, doing that, DEQ is also looking at proposing to EMC to adopt an implementation schedule. So to help make it clear for our permittees how we will go about proceeding with implementing the PFAS standards. It's important that they understand the timeline includes time to allow for assessment, source identification, then time to sample using a certified method that is approved by EPA, a certified wastewater method, which has not come about yet. And then to go ahead, and that's only after all that is done, then we would put limits and a compliance schedule into permits. To understand the implementation goals, I will first discuss EPA's drinking water standards so you understand a little bit of the relationship between the two. That's the MCLs. Talk about the potentially affected sources so you understand who they are. Okay. And the types and levels of PFAS that we are seeing with the current data that we have gathered. And then plans on how we will implement that. And as Sushma also pointed out, we are also currently seeking input from our permittees to help us with input on the implementation schedule so we make sure we understand all their concerns. Okay. So that is just what I went over, so I'll just proceed from here. Okay, first, the drinking water standards that EPA has proposed are mainly impacting the PFOA and PFOS, which will be 4 as an MCL, as parts per trillion. And then they have 4 other compounds that they were regulating using a hazard index. Basically, they looked at some of their health advisory numbers and said that they should not exceed them. And that's what this one essentially comes up to be. Public water supply systems state we serve over 9 million people. And 459 public water supplies receive source water from surface water bodies. 41% of large public water supplies, that being greater than 10,000 people, exceed EPA's proposed standards. So you can see that there is we have an issue, and it's not coming from the public water supplies. The PFAS that we're seeing is obviously coming from somewhere else. So reducing PFAS in surface water discharges will reduce cleanup requirements and the cost for public water supplies, which of course they are very concerned with. And so these standards or proposed standards of PFAS would certainly complement the drinking water standards that are under the state authority. So what type of sources are impacted? Basically, our industrial dischargers that have individual permits, both major and minor. Wastewater treatment plants for municipalities, POTWs with pretreatment programs. When they have a pretreatment program, they of course have significant industrial users. And then major POTWs that don't have pretreatment programs. They would certainly have PFAS as well. Major and minor industrial process and commercial facilities, ones that may not be targeted by EPA at this time, but just end up having PFAS. Whereas, again, this is an investigation at this point. We are not clear on exactly every source that has PFAS. Groundwater remediation sites could have PFAS, and of course, water treatment plants that treat their water, especially with a RO or ion exchange, and they have wastewaters they need to discharge. As a result, they probably have concentrated or will concentrate the PFAS and will need to discharge those wastewaters. To be more specific, as far on the industrial side, EPA has targeted specific industries that are likely to have PFAS in their wastewaters. Those are organic, chemical, and plastic synthetic fibers, metal finishing industry, electroplating, electric and electronic components, landfills, pulp and paperboard facilities, leather tanning and finishing, plastics molding and forming, textile mills. We're seeing it quite a bit in textile mills here, paint formulating, and airports. That's not an all-inclusive list. That's just to give you an idea. We know centralized waste treatment systems, they're likely to have PFAS as well. We've seen it in some of our food processing facilities as well. Potentially affected industrial dischargers. We have 57 major industrial dischargers, and we estimate that 70% of those, according to EPA's targeted industry that they have said likely have PFAS, about 70% of those will have PFAS, could potentially have PFAS. We have 133 POTWs with pretreatment programs. We estimate that 64% of those have significant industrial users that could likely have PFAS. If you look at our 606 significant industrial users in the state, we estimate that 65% of those could potentially have PFAS. If we look at the specific industrial types. This just breaks it down even further to show you how limited our data is. We have sampled 15 major industries, that's it. We have sampled 3 minors, and we have sampling data mostly from our POTWs with pretreatment programs, and that's really where we've gathered most of our data to date. If you look at where the detections, and then you look at the ones that are showing above proposed standards, you're going to see that PFOA and PFOS are the drivers. Okay? That's where we're really seeing every municipality comes in, shows and has detection levels of PFOA and PFOS, primarily PFOS. If they usually have that, and they might have one other PFAS that's part of the hazardous index group that is put out by the drinking water. So, but the driving force is the PFOA and PFOS limits. Give you a little more data. This is just a grouping of average concentrations that we've been seeing across those groups I just showed that we have sampling data for. PFOS being the most evident PFAS that we're seeing. But when we come with standards proposed to the EMC, we are adding 2 more in addition to the 6 under the drinking water. And those 2 added are the XS, and PFNA. And you can see that we have concentrations of that shown by these groups. This is another way to look at the concentration ranges. The blue is the minimum for industrial majors, the dark blue being the maximum. Industrial minors is the lighter orange, and then the darker orange. And POTWs majors with pretreatment programs, the lighter green and the darker green, showing you min and max concentrations. Again, even though you see high numbers on some of these other PFAS, the discharges do get credit for dilution, and they do have higher numbers. The PFOA and PFOS, though, will have 4 parts per trillion, and those will likely be the driving regulations on treatment. And there we just put a map together to show you POTWs with pretreatment programs across the state. Keep in mind that 64% of those had significant industrial users that had PFAS. So not all of them, but it just shows you all of our POTWs with pretreatment programs. And in addition to that 64% that only have SIUs with PFAS, 8 of those POTWs collectively receive discharges from 27% of the SIUs that are suspected to be associated with PFAS. So it does really narrow down, and it helps us know who we really need to be working with and doing the sampling at. Potential industries that are impacted, just want to give you a visual picture, and there are 57 majors, but of that, there's 70% of those that have PFAS. And then the minors, we just don't know enough information about, but I'm showing there's 24 and where they are at across the state as well. So our implementation plan, what would it involve? First, it would involve getting together with stakeholders so that we can hear their input and their concerns and what issues they may have. But I need to tell you, our implementation plan is constrained by certain factors right off the bat. One, that EPA finalizes their MCLs, because we need that published scientific data. Also, it's contingent upon when the certified wastewater test method goes into the Code of Federal Register. Okay. And lastly, it's contingent upon the EMC adopting PFAS standards and when that occurs. But given all that, and if I just make certain assumptions, which I have with this, this is how it would go. Right now, we are doing assessment monitoring, and we would just continue that regardless. We're doing assessment monitoring. Many of our POTWs have come to us and they said, it's not us, it's the SIUs. We said, we know. They said, let's sample them. We said, great, sample them. So many of our POTWs are out there sampling their SIUs right now and trying to figure out where the PFAS is and where they can take action. So a lot of that is happening right now. We're continuing that, and we're continuing to ask POTWs to leverage their pretreatment authorities to work with them to get BMPs, best management practices, to seek PFAS minimization plans, and to help them just learn where it's coming from, quite frankly. So that would be really for the first 2 years, from this year and through the year 2025 as well. In the meantime, we are putting a condition in each permit, and mainly industrial ones that we suspect have PFAS, and POTWs where we know we've measured it and or suspect it because of their SIUs. We are putting condition that when EPA does finalize a test method and get it in CFR, then they have 6 months to start doing some testing and actually give us some certified data. So we are putting that in permits today. We don't want to ignore new facilities coming into the state. These mega sites, landfill leachate systems who are putting in treatment now. We are telling them these are rules that they're coming. If you're going to design treatment, design it right. Let's get it down so that you protect downstream water supplies. So we are working right now doing that. So if we assume that we push these PFAS standards forward, it would be around the end of November where we might be adopted by the state. It wouldn't be to the end of December that we see a test method approved by EPA. That could happen sooner. But again, we have to have it for our own rules. It has to be published in CFR. So once this test method is even certified, we need to give our dischargers time to use that certified method. So we see that happening from the middle of 2026 through 2028. That would either confirm or not confirm the test results that they had from other test methods. And based on that, the permit writers would be able to do a reasonable potential analysis and decide whether to put limits and a compliance schedule on the permit. And that would happen mainly for the industrial users in 2027 through 2033. Again, we renew permits on 5-year cycles. That's why that length of time. And we would do the same for the POTWs with pretreatment programs through 2028 through 2034. Some things to keep in mind. We don't have staff to do this all at once. So minor POTWs, we would certainly try and have them collect PFAS data, but they wouldn't be at the top of our list unless we were seeing elevated levels of PFAS or mainly ones that are impacting downstream water supplies. 100% domestic wastewater permittees, again, not at the top of our list, not even probably looking at them until 2033, and really may not consider them unless they're impacting downstream water supplies. And I probably should add to that too, or impacting if we came up with biosolids regulations or something where we're seeing it's really impacting what's happening out there. Small discharges, less than 30,000 gallons per day, are generally considered de minimis. So we would recognize that we're probably not doing much work in that area. And we really need to work with the water treatment plant stakeholder group to see how best to implement it with them and their impacts. Again, this is contingent on a lot of factors, mainly one, getting a wastewater certified test method. One thing we would like to do and put in with the PFAS standards, and we had questions, I think, Commissioner Tweedy earlier. Generally, we have put the standard right in the permit, and then we put a footnote that says, well, if detection level is, if the limit's 0.35 and the detection level is 1, then we have to put a footnote that says, well, anything less than 1 is meeting this number. Other states have just said, just use the PQL or the MRL, just put that in the permit. And it seems like the permittees prefer that method. So with this standard, we would like to take that approach where we actually put it, we're just going to put what the MRL, the PQL is. In this case, EPA has recognized it as 4 parts per trillion for PFOA and PFOS. If the test methods improve, and it calls, or if the other PFAS numbers, if they are lower, we won't put that lower value in, we'll just put the PQL in. Only after 5 years, if they significantly improve, then we will work with the permittee and lower that value if need be, until we reach the state actual standard. And that is how other states have done it, so this isn't unusual. And that one, telling you, we're proposing that we would consider doing that, so it makes it, the permittees seem to be more receptive to that. So that is all I have. Just wanted to just let you know how we were looking at it, and just the idea that it's important with some of these regulations that we have a way of implementing and letting our permittees know how we would go about it.
Real quick comment, and then I'll open it up for committees, but a question was the chart or the map of the downstream in the Cape Fear area. You had some of those areas recognized, about 3 or 4 back. That's it. So that process, I think, is down in the Cape Fear. You have a line there. Is that sort of like from a Fayetteville? It looks like Fayetteville down to Wilmington. And it occurred to me just then when you were talking about detecting at the Chapel Hill, we in particular had something come up here at the end of the year about they had detected more of the PFAS compounds. I think it was 11 or so, and it was 8 that the EPA had no idea what it was. So I guess the analytical techniques that what are you using? Can you give me an example of some of those analytical techniques that they're doing to detect something that EPA doesn't know about, and we're finding it right here in our state? So when we start making these suggestions, or these recommendations for rulemaking, then do we have something going on here in North Carolina that no one else knows about?
Well, so we have a lot going on in North Carolina that's different
Let's
than
zero
other
down into
states.
to the
Okay, given that
analytical
we have
techniques out there
Comores,
for
and
different
we have a
techniques.
lot more different types of PFAS than any other state, given that we have Comores. So let's be clear about that. But the proposed rules would focus on 8 specific PFAS, nothing else. That would be what the regulations would be. We do have test methods 537.1 modified that's commonly used for drinking water. And that does tell us a lot, and it does include a lot more PFAS than what we would be regulating. And we would be able to see those. Are there more? There's probably thousands and thousands more that we can't test for and are not seeing in this test. But that is the best that we have to do at this point in time. There is another test method, 1633, that's more geared towards wastewater, but it only looks at 40 PFAS. The other test for drinking water actually looks at more. So, and then of course we have all the attachment C PFAS that we know are Comores signature type compounds. And sometimes we'll have permittees do that as well, just to see what the impact is and how far reaching Comores has really impacted the state. So, yeah, it's a real tough question. We have so much, and this is why we're the leaders.
That's your director's phone, not mine. He's not here. Any questions from committee members? Commissioner Ellison?
Just quickly, what's the best available treatment technology?
For PFAS. At this point, and I won't say I'm the best person to answer this question, but at this point, what we're seeing is GAC treatment being used, and it gets them down to very, very low levels, even the short chain. The other ones that haven't been put in, there just isn't a lot put in at the state other than GAC, to be honest. Another one that we're being told about by some facilities and seriously looking at it is foam fractionalization. So it's essentially, we find that PFAS gathers on the top of water and foam. And so they're purposely making foam so that the PFAS is being drawn out of the wastewater, and then they have a way of destroying it. Okay. There is also a supercritical way to treat it as well. And there's also ion exchange or reverse osmosis. But we don't have a lot of data on some of them, I'll be honest.
Any other questions, comments?
All right, I'll let Stephanie.
Thank you so much.
All right, thank you.
That's a great response. That's good. Your phone's going off there. Introduce him.
Good afternoon. My name is Stephanie Billiard. I am the Senior Engineer Lead Assistant Secretary. I will be covering our approach to doing our cost-benefit analysis that'll support our fiscal analysis in terms of the impacts of our surface water quality standards related to PFAS. To get to your best available technology question, we will be covering our approach on how we selected technologies, and we can delve into that a little more. Hopefully we'll answer some of those questions. So first, starting with our desired outcome, our fiscal note. Before I begin, I want to note that this is a way for us to provide transparency to our process. So regardless if we're talking about outcomes for stakeholders or decision makers, transparency is at the foundation of those outcomes. So for stakeholders, we would like to be able to provide the rationale on what changes are necessary, what the problem the rule is addressing and how it will address that problem, what are the affected entities, and at the end of the day, what are the cost benefits for this proposed rule. Specifically for decision makers, we're going to provide the necessary tools and information for you to make informed decisions based on science, available technologies, and so forth. It'll also allow us to understand the relative magnitude and distribution of the cost and benefits, as well as the net impacts. It will also allow us to provide comparisons to our baseline and also to other alternative approaches that will be proposed. It'll also allow us to illustrate some of the uncertainties and the degree of confidence we have in the expected outcomes, since as we know, we've talked a lot about uncertainty and the need for additional data. We will be following both fiscal and regulatory impact analysis requirements set by OSBM in our general statutes. There's two main areas. One is focusing on making sure we understand what the impacts are to all entities, and also, most importantly, demonstrate that we have sufficient state funds to support the implementation of a rule. And then specifically focus on economic principles. We are, in our approach, looking at seeking reduced burden on regulatory entities, looking at what the cumulative effect might be for that rule. Most importantly, considering sound and best available data and information. And we also want to make sure that our rule objective is cost effective and in a timely manner. So what's going to be important to note is some of our key starting points before we discuss what our cost benefit analysis and methodology is. So keeping in mind our proposed rule is taking our surface water quality narrative standard and translate it into a numerical standard for 8 PFAS with known toxicological data. Subsequently, with that information, we would be able to incorporate effluent limits into permits per the implementation schedule that Julie just highlighted. A sensitivity analysis is going to be important because there are going to be some uncertainties, some engineered and key assumptions that we'll need to make. We'll also need to consider how we deal with research or data limitations and how that variability will affect results. For example, taking our POTWs with pretreatment programs. If an SIU has PFAS going into a POTW, one of our scenarios would be having treatment completely upstream, and that would not have additional PFAS loading to that facility. But on the flip side, we could also cost out what it would be for municipal pretreatment operators to take on the full treatment and cost burden at the facilities and not have any additional SIU reductions. We're also looking at the availability of DWI infrastructure funding that would be able to offset any costs for monitoring, planning, design, and so forth. And then also during our stakeholder process, we will be on the lookout for any additional sensitivity analysis that we could undertake. So on the cost side, we will specifically be looking at which entities are impacted. So here we propose that we have private sector impacts, local government, as well as state government. On the benefits, we will be estimating what the anticipated benefits are for these PFAS regulatory alternatives relative to the baseline. We will be able to quantify and qualify some of these benefits. Quantitatively, we will be able to look at human health benefits. There's some that will be qualitatively looked at, also taking into account ecosystem enhancements and economic benefits. And then lastly, looking at any reductions of upstream PFAS on a public water supply would be considered a treatment cost savings. So the main cost categories that we would need to consider for the various sectors is mainly monitoring, minimization, and treatment if it is deemed required. You'll see that's the same for local government and for state government, specifically looking at resources that are available to implement the proposed rule and program. The cost drivers and timing will be important because we are going to be projecting costs over a 30-year cycle from 2024 to 2053. Implementation plan will specifically be used to drive how we determine the scope and of our impact, as well as when that would happen. There will be a subset of permittees that are considered priority facilities based on the information that Julie had just highlighted in terms of how they relate to potential for PFAS to be under discharge. Keeping in mind that as we have existing PFAS data, that'll also help us determine those priority facilities, and also taking into account what facilities are upstream of drinking water intakes. Some more fundamental cost drivers that are pretty consistent across cost benefit analysis is using guidance from OSBM to do a 7% discount rate. The project life of 30 years does take into account the implementation schedule, including monitoring and also the installation of a treatment system. Costs will be based on 2024 dollars and escalated where appropriately based on future indices. So monitoring costs, we are calculating these costs based on a sampling event. The frequency is based on implementation planning schedules, but we're also looking at long-term projections, again, over that 30-year period, to go beyond just looking at the monitoring assessments, but looking at the incorporation of an effluent limit, compliance schedule, and then any needed continued compliance sampling. That is actually being projected based on the various facilities' permit expiration date and prioritization. The various cost categories that we are looking at is the cost to analyze samples. The number of samples that are assumed are following standard QA/QC procedures outlined by EPA. We're also taking into account the supplies, the labor required to collect samples, data review, and also coordinating either with the regulatory agencies such as DEQ or pretreatment operators. And then also taking into account the future cost escalations will be considered on the lab costs, labor costs, and supply costs. At the end of the day, we'll be able to have a total dollar amount per event that we can then project across all types of entities. So one of the areas that we are looking at is projecting out minimization. So if we have an SIU or an industry that is seeing PFAS under discharge, DEQ is going to strongly encourage that they determine how they can minimize their costs, PFAS in their discharges, and therefore reducing costs. So some of the ways that can be done is material replacement and substitutions, replacement of PFAS infrastructure, containing infrastructure, changing the manufacturing process to minimize PFAS formation, or simply looking at BMPs to reduce the PFAS that might be going into a stream for final discharge into their treatment systems. The cost aspect of that is looking at evaluation and planning, so having consultants and experts help come in and evaluate a facility, looking at the costs associated with product replacement and substitution if it's available, and then if needed, if you get PFAS completely out of your process, but it could be residual in the infrastructure, there could be costs associated with replacing infrastructure. So on the treatment costs, we're doing a standard industry type estimation with the assistance of our consultants, TRC and Brown and Caldwell. The cost components I'll briefly go over today are capital expenditures, so that's going to be the initial investment in treatment, operation and maintenance, which is going to be a reoccurring annual cost, and then also looking at costs related to repair and replacement. So at the end of the day, we want to make sure that our cost assessment is robust, and we're not just looking at how much is it cost to just put granule activated carbon in and ignore the remaining aspects of what is realistically needed to design and install that system. So getting into technologies, before we can even start our treatment technology overview, we conducted a comprehensive treatment evaluation with our consultants. We focused on shelf-ready technologies, but also proven in the field scale. So yes, there are going to be other technologies you probably heard about. We wanted to make sure what we were costing out and looking at were things that we knew could be permitted and implemented and operated in the field today. The types of treatment that came up in our analysis are granule activated carbon, ion exchange, and reverse osmosis. Keeping in mind that treatment technologies, the efficacy of that will be determined based on the sector and the wastewater type. So that's where we are looking deeper into the industry type, the flow rate, PFAS concentration, distribution of short and long chain, but also understanding the wastewater matrix. There could be other things beyond PFAS that could impede or compete with these treatment technologies. The capital cost. We are following industry standard through the Association of Advancement of Cost Engineering, a Class 5 estimate that was recommended by our consultants. Things that are included in that cost assessment are total installed costs. If there's any pretreatment that's required, that's included. Electrical and water supply, buildings for infrastructure operators, any other infrastructure that cannot be outside. It's also important to note that we are allowing a 35% contingency for any unforeseen costs. And then most importantly, when we calculate our costs, we are going to be determining the average value, but to be able to account for the low end and the high end and some of those variabilities, we are using a negative 30% for the low and plus 50% from the average value for the high end. Keeping in mind that treatment costs are not going to be the same for different concentration, different flow. So our consultants developed cost curves for each treatment type based on flow rate. And this was based on actual vendor estimates from their extensive treatment database that looks at design costs for either completed or existing projects. So they didn't need to call up vendors and hope that we got that information. These are very specific to real world examples. The ways that we're going to benchmark and make sure that our costs are reasonable. We are receiving PFAS funding applications through Division of Water Infrastructure for water and wastewater systems. There are costs there we can use as a check. And also Minnesota recently published a similar report on the removal of PFAS from wastewater. And that's also an extensive report that we can also use to benchmark various aspects of our cost analysis. So on operating expenses, this is going to be typically the replacement of media or dealing with membrane fouling, so ultimately clogging of a filter, depending on what treatment technology is installed, an operator to manage and make sure that facility is operating correctly, electricity, chemicals if needed. Also, most importantly, residuals management. Each of these treatment technologies will have some type of residual to manage, and then also the typical equipment and building maintenance. And then lastly, benefits. So we talked all about cost, but there's of course going to be a benefit to reducing PFAS concentrations in surface water. One thing to note here is typically we want to do this during our rules development, but there's not always this information available. There's not always the cost to some improved benefit to someone's health. In this case, we have human health benefit data quantitatively that we can look at specifically for improved cholesterol, blood pressure, and birth weight, specifically off the EPA's economic analysis for their proposed PFAS MCLs. Our plan is to use any available national studies and extrapolate to North Carolina. The health benefits that we can discuss qualitatively are improvements in certain cholesterol, improvements and reductions in small for gestational age, and then improvements in antibody responses. Additionally, qualitatively, we can look at the environmental and social economic benefits. For example, accidental ingestion during recreational activities, reduce PFAS exposure to fish that then will reduce exposure to humans that would consume that fish, any ecosystem enhancement, wildlife protection, and then also any commercial, community, natural resource, societal improvements. In addition, quantitatively, we can look at the reductions in PFAS going into drinking water treatment intakes by looking at reductions in cleanup requirements related to treatment costs. And then in addition, we can look at reduced ratepayer impacts. In addition, as a benefit, there is various infrastructure spending at the federal level and also state level that can be considered in this process in terms of costs. In addition, these are some of the data sources and methodology that we've been able to identify that will be used for our cost benefit analysis. EPA, again, did a robust study on various health outcomes on a qualitative and quantitative basis. We can also use other state reports as guidance on how they've used various national data sets to extrapolate to their state. And then there's various academic and research institution papers that we can reference as well. So I think most importantly here, our next steps are to continue our analysis of the fiscal note and ultimately at the day come to a summary of what the net impacts will be. So we've talked a lot about a lot of complex cost and benefits. So what we will be doing is summarizing those net impacts by looking at the benefits and the costs, and then calculating net present value. So our net present value is going to represent the value of the effect of the rule, and it is calculated over the net impacts over time, looking at discounted rates and calculated to present value. So here's just an illustrated purpose of what we anticipate to present in our fiscal note to summarize all of this information is looking at the benefits from human health, savings to downstream drinking water intakes, and infrastructure spending. And then for illustrated purposes, we will be breaking out the private sector, local government, and state government costs, and then bringing that everything back to net present value in 2024. So our next steps is we are currently conducting our fiscal analysis. Our plan is to, we're working with OSBM weekly to update them on our progress, get their input, ask questions, make sure they're well up to date on what we're working on. And in the next meeting in March, we plan to have a certified fiscal note that'll include our implementation plan, our proposed rule updates, and then of course the detailed cost analysis. Any questions?
Thank you, Stephanie. Any questions from committee members? If not, thank you so much. I'm sorry, I apologize. Commissioner Deere,
Thank you,
apologies.
Chairman. The contracted engineering firms that are doing this work for you, are they looking at any type of optimization analysis for the best combination of POTW treatment and SIU? Or are you just keeping those completely separate in cost estimating?
No, one of so the consultants are giving us the information that'll allow us to move forward with our fiscal notes. So we do have average concentration and concentration ranges for each industry type, which is going to drive costs. We are going to have to project out looking at, if we look at all the treatment at the POTW, what's the cost? If we look at reductions 100% or 50% upstream, what's going to be that influent and therefore cost for the POTW? So we are looking at a sensitivity analysis to see where the most effective treatment can occur from a cost perspective. But we're also having to project out to, at the end of the day, any residual background from the POTWs would expect to still have to treat with all SIU contributions removed.
So there's no scenario analysis plan for combinations of strategies. It's either all SIU work or all POTW work.
I think the way to answer that question is we're going to bookend the cost estimates. Part of the fiscal analysis process is, as you see, in most rulemakings, we can never be exact right in the middle of what the costs of the rulemaking are. So typically, states and federal agencies develop these approaches to come up with a range. And the range is based on good engineering judgment, based on available data, and computations using sound techniques. So what Stephanie talked about is we know in a given area or site, there are contributing sources. So whether it's a direct discharger, for those industries, the costs are for those direct dischargers to comply with an NPDES emission permit limit. So the cost for those systems are going to be how Stephanie described, which is the CapEx and the OpEx costs. They're pretty straightforward. Where it gets complicated is when you have a wastewater treatment plant that is receiving water from a variety of sources. In that case, the options for that utility is to clean up all of it or rely on, as you heard in the 1,4-dioxane story, identify the biggest contributors and do this prioritization and reduce that, the cleanup at their site. And what Stephanie's talking about is we would look at the type of industries that are contributing to those POTWs, and then based on their loading, do the best we can to maximize the treatment for PFAS. And then that'll give us an idea of what that range for that POTW could look like. It is a bit of a, estimation and juggling act, but until they actually have to do it, it's never going to be exact. We're hoping that this process provides some transparency on the methodology, and we would love to get some real world feedback on whether, how we can tighten up that range.
Thank you. Just one other question, and I'll be finished.
Yes,
Is
Commissioner.
the ecological and socioeconomic benefits. You're just going to do qualitative. You're not going to look into the literature to see if there's any research done on quantifying some of that?
I mean, certainly our hope is that if we can get quantitative data that we would. I think based on our initial searching, it would be more likely qualitative because that's what we saw from EPA.
This is one of the hardest part about environmental regulations, is that when rules or regulations affect human health or environment or natural resources, there's really not a direct benefits value. It's usually easier to calculate the cost of complying with the regulation. In this case, we're scouring as much as we can to find those resources. We're looking for ideas and reliable resources from our stakeholder community to be able to use. We're going to rely on OSBM to see if there are other techniques that can be utilized to account for the diversified benefits that we know reduction of PFAS, at least the 8 that we're targeting that have human health and ecosystem impacts. It would be good to include that in the analysis so there is a comprehensive, robust cost as well as benefits in there.
You might add reaching out to the economic research community to see.
Thank you.
Thank you, Stephanie. Any other questions from committee members? Thank you so much. That's going to wrap up our information items, and we're going to move now to the last 2 items on the agenda. Again, I apologize for the extended time. Next time I won't put so much on this agenda, but these are items that has to come before this committee to get to the rest of the commission, and we're doing a pretty doggone good job today, but we're an hour and 15 minutes longer than we're supposed to be, and I apologize to the water and wastewater, So, see, I'm already getting tongue-tied. I'm tired. The Groundwater and Waste Management Committee is next. So I've asked these next 2 discussion items, one being on the wetlands and the other one being on the flow rate. They're the wastewater design flow rate. They're both tied into session law. And we just need to spend about 5-6 minutes on this. I know you've done a lot of work making preparation, Sue, and the others, but if we could sort of tie this up. We did add it as a discussion, just so we can get it out here on the committee. Thank you.
Take it away, Sue.
Thank you. I'm Sue Homewood with the 401 and Buffer Permitting Branch. I'm going to quickly talk about a portion of Session Law 2023-63, clarify the definition of wetlands. I highlighted the most important part here, that the General Assembly in this past session law chose to direct a different definition of wetlands for North Carolina. And the session law goes on to talk about the commission adopting a rule consistent with this new definition. So we put together a proposed rule development timeline. This is the quickest timeline possible, and that would be bringing a rule to the Water Quality Committee at the March meeting. Just highlighting that then we would have to do a regulatory impact analysis and OSBM review in time to get to the EMC in May. Going through the rest of that, we would be back before the EMC in November to request adoption of a rule. Per the session law, that rule will not go to the Rules Review Committee or Commission, but instead would be subject to legislative review. If adopted at the November meeting, that would make the deadline for the 2025 legislative session. Depending on what action they take, it could become effective 31 days into the legislative session or some time after that if a bill is introduced. And just to note that because these definitions are part of the triennial review, this rule, following that entire process, would need to be forwarded to EPA. As you heard earlier, they have final authority to review those rules. The commission has previously seen a list of rules that this definition change affected. And just really briefly, the list here, and it probably isn't exclusive or all-inclusive, these are rules that just use the term wetlands. They don't have a separate definition. Nothing needs, we don't believe anything needs to be changed in these rules. The wetlands that are referenced now in these rules automatically point back to the new session law definition. There are a couple permitting rules, and these are rules that are only applicable when activities that would impact wetlands. One of those is our 2H0500. We call those our 401 certification rules. Those are only applicable to jurisdictional wetlands, so no change occurs to these rules at all. We have what we refer to as our isolated wetlands rules. Those are in 2H1300. These are applicable to isolated wetlands and streams. It is necessary to retain this rule for use in isolated stream impacts. Modifications can be made to revise this rule to remove references to wetlands during the rule readoption process. That's the most efficient path forward to being able to get the definition rule on the schedule sooner. In the interim, DWR can ensure that there's clarity for our regulated public that even though these rules are still on the books, they would not be necessary for impacts to wetlands that are deemed as non-jurisdictional by the Corps. And there was a third set of permitting rules. They were temporary rules, the 1400 rules, and those have since expired, so there is nothing necessary for those rules. And I think I might have made it in my 5-minute window. I'm happy to entertain questions if you still have energy.
Taking the food away.
Any questions, Sue? At 2, yes, Commissioner Twitty, and then Commissioner
Oh, all right.
Allison.
Real quick one. So the, hey, Sue. The rule is gonna, that the EMC will adopt is gonna go directly to the legislature. Is it clear on whether the legislature will do an up-down vote? Do they have the power to modify the rule at that review? Is that clear?
Yeah. It's, the legislature, it gets introduced to legislature. If legislation is introduced to address oppose it or anything of that nature, then the legislation will proceed. If no action is taken within, as she mentioned, 30 days, then the rule becomes a rule.
Okay.
They would have to introduce a bill.
Yeah.
Okay. All right. Thank you.
Commissioner Allison?
When was the statute passed? Was that like late June or July?
Oh, I don't have that date in front of me, but yes, it was this summer.
6-8
fall,
months ago,
maybe. Yes.
I just think that, it's been 6-8 months. This is a law with which we must comply. We are directed by the legislature to do this, and I think we can move faster. I'm not sure, I know there are public notice timelines and things like that, but I think a lot of your schedule can be compressed and that we ought to be able to get this done in less than a year because it's relatively simple. The language is not something to be debated. So it's just a question of plugging it into the rules that must be changed and going through the public process. And I think we can do better.
So this is the fastest possible schedule while meeting the APA. There are timelines and there are filing deadlines that between the EMC's schedule and the filing deadlines with OAH and the required 60-day public comment period by the APA, this is the fastest schedule that can be put together that meets the APA unless there's special meetings in the process.
But you're not doing anything till March or April. You're not submitting anything till March or April. What are we doing between now and March, April?
So the rule has to come before the Water Quality Committee and request approval to go to the EMC for public notice. The next meeting is March. So that's the next meeting. We would come with an action item to proceed to the EMC. The next meeting would then be May. And then we would request at that meeting that the EMC approve the department division to go out to public notice. And then it gets filed with OAH to go out to that public notice.
My understanding, correct me if I'm wrong, which is quite likely, is that the chair or either of the EMC or of the committee could call a special meeting. This is not going to be a big document, and we are compelled to do that. Perhaps we could have a quick meeting about just this issue prior to March so that the full EMC can vote on it in March and we can do this offline, but try to figure out an expedited schedule for the EMC's role and the Water Quality Committee's role in moving this at a faster pace because there's a lot of uncertainty out there in the regulated community. Thanks.
Thank you, Commissioner Ellison. The director and I are working very closely together, diligently, and a lot of time. And you can see from the agenda today that we've really put too much on here, but we're trying to get everything. Answer to your question is yes. We've discussed this wetland piece, the session law. And we will be getting together quite often in the next 6 weeks to hammer out what we've got coming up in March and in reference to the wetland issue. And we will be bringing those to the committee by way of either email or a meeting here in Raleigh or Zoom or whatever we have to do to put together this. This is what the session law is asking, that we put it together, and we'll get together with the committee, and we'll look to the director to give some recommendations to me, and we'll do that. We certainly will. Any other questions? All right, and we'll move to the flow rate, the wastewater flow rate discussion.
Michael Montebello will be presenting this. He's our MPDS supervisor.
Yes, that is.
It isn't.
Okay.
Screen.
Excellent.
Wow.
Thank you again. I'm going to, for the sake of time, the first 4 slides, just so you know, are just the copy of the rule that's associated with what we're going to be discussing here. So I'm going to skip those 4 just so we can go directly into the parts that apply. Okay. So the rule affects what we will call the O2T part of the EMC rules, which is the waste not discharged to surface waters. These are typically applicable to sewer systems, disposal systems, and treatment works, and it typically governs the application for and the issuance of permits for these systems. And the 2 sections that are the typical or that are being impacted are the O2T 0114, which is the design flow rates, and then the O2T 0118, which is demonstration of future treatment capacities. So originally, in the 0114 design flow rate, dwelling units were identified as 120 gallons per bedroom. There was a minimum of 240 gallons per day, and then each bedroom above 2 bedrooms increased the volume by 120. And in the rule, there was a requirement that said each bedroom or any other room that can function as a bedroom is considered a bedroom for the design purposes. There's also provision in the existing rule for adjustments in 0114F. So after the legislation for dwelling units, the flow rate is now 75 gallons per day per bedroom. The minimum volume of flow is for a 1-bedroom unit. That would be 75 gallons per day. There are no minimum number of bedrooms. Each bedroom increases the volume by 75 gallons per day. The change affects projects that are more than one unit, so 2 units or more. It doesn't apply to single-family homes for non-discharge systems or single-family individual NPDES permits. And then after November 1st, 2023, all permits issued must use the lower flow rate of 75 gallons per day. And there still remains the provision for the division to approve even lower values in O2T 0114F.
Is that throughout the state?
Yes, sir. Okay. The other part was this demonstration of future capacity, and we had a requirement to do a study for this group of type of systems. This was schools, preschools, and daycares. And what you see in red there is the current flows that are included in the O2T 0118 rule in terms of the size of the amount of flow that would be required depending on the type of system that's there. The legislation included a study that would require us to look at reduced water consumption associated with new plumbing, fixtures, and appliances. So our suggested study timeline and implementation, we're going to look at data from other states from now until mid part of the year to try to get information from other states for flows that have been used for the same type of categories of wastewater discharges. We also wanted to collect actual North Carolina data, if it's available, for those schools, preschools, and daycares. Then we're going to review and assemble the actual flow data and look at coming up with a study plan. And then for those categories which support an adjustment, the existing rule allows division-approved adjustments under 0114F. So someone could come in before the actual rule was changed and ask for an adjustment based on the information that might have been collected. So additionally, the rule also talks about permitting capacities for sewer collection and treatment systems. And there's provisions in this rule to allow for permitting capacity adjustments and flexibility when you consider the location, the growth, and the timing of construction. And it applies to both local programs, permits issued by the public entity, by the regional office, and all division-issued permits. And provisions have been made in our application forms that allow for implementation of this additional set of requirements. And effectively, at this point, we have placed on our website updated forms effective November 1st, 2023. We're using the 75 gallons per bedroom. We're asking all the regional offices that are doing the fast track programs to do that. Local programs are also required to use that. And again, just as a note, there now is no minimum number of bedrooms, of one bedroom, house, apartment, whatever. It would be 75 gallons as far as that goes. And and we've implemented, as far as I know, all of this has been implemented at this point.
Question, when you're doing your study, could you give us a list of all of the stakeholders that are a part of your study group? So we'll just know who the stakeholders are in reference to wastewater flow.
Certainly, that would be, if we collect data from municipalities, not every municipality is going to have those kind of schools. We would certainly identify where those came from and what types of schools were there.
So when you bring in the study group, or the stakeholders of that group are going to be those who are applicable to this rule moving forward.
They would have to have those facilities in order to provide us the information.
Okay. Any other questions?
And I apologize for doing it so quickly, but I want to get us through the afternoon.
Just a discussion item.
Thank you.
Any other point?
I believe the change.
Thank you. Director's report or remarks?
I will hold my comments till tomorrow, Mr. Chair.
Same as well here. I just want to thank you again. The Groundwater and Waste Management Committee. Do you want to do that in 5 minutes, 10-minute break, 5-minute break? But there'll be, I'd say, a 10-minute break and then right back here for that. Thank you so much.
10-minute break.
That sounds good.
Thank you, Mr. Chairman. That was a lot for you to have to do for your first meeting.
That's got to come out of the gate strong.
Let's see this war.
I told Bill, I thought we'd be making a run for it. I don't blame you, but you should have done it earlier.
Did y'all see JD left?